Okay, how's everyone doing today? Um, so we do have some news and stuff to cover. Uh, Mostly like the updates on whoop, mostly like the updates on like the healthcare system and what the state is on that, as well as a lot of pressure coming from the NDP in the form of uh what was it? In the form of the like having the liberals put more funding in towards the healthcare system, if I remember correctly, because we're currently on a healthcare crisis. And then we have uh, some fusion energy stuff, which is very intriguing, which I can be looking forward to talking about. And then we have Jim Carr's death, which we'll discuss a little bit, and then the Iran or the government of Iran has publicly hung uh, two individuals, and we also have something that I want to talk about, which is the uh, the AI generated like art and the AI generated like essays and stuff. So yeah, I guess let's just hop right into stuff. Right.
Kennedy Smith's 3-year-old son Theo is down with a case of the flu, and she's worried about her options.
I'm feeling kind of overwhelmed and scared because the last thing I want to do is end up in Chio.
She's trying to avoid this place, the Children's Hospital of Eastern Ontario. A hospital built to serve 120 children a day is seeing more than that every hour. Since September, nearly 1,000 flu cases have been reported there, a record this early in the season.
What we're seeing right now is the huge number of viral infections and a huge amount of patients coming to emergency rooms and also being admitted to the hospital.
The situation has been made worse by a staffing crunch.
So the main issue with the entire healthcare system is that like we know who is responsible um for the underfunding of healthcare and why so many hospitals and whatnot have problems with staffing and uh, and wages and stuff like that. It solely it solely falls on the premier's shoulders, right? And the fact that they're trying to you are trying to gain more money from the federal government, despite the fact that they have uh, a good couple billion at least per province for healthcare that they haven't spent, and just put it to like other unnecessary things like executive bailouts or whatever. Like it completely ridiculous, right? And the fact that we have to discuss this at all and have to have like uh this discussion in general is just like it's just idiotic. Like I don't understand why you just don't fucking spend the money that you were given to go towards the healthcare system instead of undermining it and everything.
Beyond critical. I've said before we're at the bottom of the barrel, but we're not. We're beyond that. We're below the bottom of the barrel. We scraped the barrel and we've broken through.
The premiers say they're on it, but need help from Ottawa.
Hmm. Hmm. A lot of conservative premiers here. that are asking for that are like essentially begging the government to give them money. Which the funny thing about this is that like pretty much all of these premiers want some form of extra funding towards the healthcare system with no strings attached. Essentially, what that means for them is that they want to be able to spend it on essentially whatever the hell they want. Like the federal government did state that they would give more money for healthcare, but the biggest thing for them is, or the federal government is that they want a commitment that all these fucking conservative premiers are actually going to be spending that money, like every single dime of that, on healthcare, not on whatever idiotic things that they're going to be spending it on. Right? But a lot of these conservative premiers just don't give a shit about it. That's why they're underfunding and undermining the healthcare system to begin with. It's just ridiculous. It's not hard to like spend the money that you were given on healthcare. Like we could have one of the better healthcare systems out there, but we don't because these fucking clowns don't actually spend the money that they receive on the healthcare that people want and need. Like that's even just like for the basic Canadian citizen. That's not even going into what they would define as like special cases, such as, you know, mental health institutions, clean needle programs, you know, helping those with disabilities, like retirement homes and whatnot. But that will never have fucking happen. I would genuinely be surprised if like any single one of these fucking premiers actually did that.
We need to make sure we sit down with the federal government.
Building Ontario, he's fucking
together
destroying
a
Ontario, man.
Deal that we see continuous funding moving forward for decades to come.
Now they're getting support from the federal NDP. Jagmeet Singh is calling on the Prime Minister to urgently spend more money, cash to hire doctors and nurses, and keep the ones we already have.
Justin Trudeau has a responsibility to sit down with premiers and find a solution. First and foremost, that is the number one thing we're calling for.
Singh said if Trudeau doesn't come through, he's prepared to walk away from the deal to keep Liberals in power until 2025. The minority government needs NDP support. While politicians squabble, parents are left waiting.
I'm worried about, okay, if he does...
And it's completely unfair to, like, it's completely unfair to everyone, especially parents and children that are currently suffering from the ongoing healthcare problem that is unfortunately plaguing a lot of families across the country. Like it's disgusting. Like I don't understand why these fucking premiers can't actually, you know, recognize that what the fuck that they are doing is completely ruining people's lives and just not give a shit.
Get sick, is he going to be able to have a bed if he needs to get admitted? Because there's a lack of beds right now. Is there going to be enough nurses that are on staff that can take care of him?
Okay, JP, so what is the federal government's position now on helping parents like Kennedy?
Yeah, Adrian, the feds say they understand the situation is dire, but they're not going to cut any more checks until the provinces agree to certain terms. They want to make sure their money is going...
And those terms, for the record, are is literally just having people spend have the premier spend the funding that they receive to the healthcare system instead of idiotic shit like, I don't know, the fucking Alberta Sovereignty Act or whatever dumb shit they decide to spend it on. Like, that's what they want. They want that commitment.
Into some critical areas like primary care and mental health. The Prime Minister has said he's prepared to increase the Canada Health Transfer, but what's left to be determined is how big it will be and if there are any strings attached.
All right, JP Tasker.
I mean, I think in this instance, like, having a couple strings attached, being like, hey, you should be spending money on healthcare instead of, like, not, doing that. I think that would be completely justified and okay in this instance. Like, people are not doing well right now. Like, they need some form of relief, and they're not getting it.
In Ottawa, thanks, JP.
Okay. So yeah, Jagmeet Singh is threatening to pull or is threatening to, like, not help the Liberals if something isn't done about this, like, reaching a fucking agreement with psychotic provincial governments. So yeah, we have a couple articles, and then we'll get into some other, like some articles about that, and then we'll get into the some of the other crises that are currently going on within the healthcare system currently. So yeah, Canadian health care is facing a national crisis that requires federal action to solve, NDP leader Jagmeet Singh says. He's correct about this. The Red Cross being called into children's hospitals in Ottawa, trailers being set up because of the overflow in children's hospitals in Alberta, children dying because of the flu in BC. It is clear that this is a national crisis and it cannot be solved at the provincial level. I don't know if I agree with this. It can 100% be solved at the provincial level, except a lot of premiers are doing this for political reasons, right? Whether it's, to increase the private sector, because, like, to be honest, Canada already has a two-tiered healthcare system, right? Like, look at, I don't know, chiropractic work or physiotherapy or dental or, whatever. Like, we already do have a two-tiered system, and, like, we could easily eliminate it with all the funds that the premiers get, but it's not going to healthcare, as we see time and time again. And it also doesn't help that, a lot of these premiers, like the ones that, or some of the ones that were mentioned here, were, like, actively lying about, like, the situation that was going on within their respective provinces. Doug Ford lied, Daniel Smith lied, Scott Moe lied, Stephenson lied. Like, it's ridiculous. It can easily be resolved within the provincial level. The premiers just don't want to do it. Cannot be solved on a provincial level, Singh said in an interview with West Block Mercedes Stephenson. One of the major concerns is human healthcare resource shortage. The worker shortage, healthcare worker shortage, that cannot be solved by provinces who are trying to recruit from one province, creating a shortage in another in the province they recruit from. That's not a solution. Well, the main reason why a lot of healthcare workers are leaving from like Alberta or Ontario, and that they're having a lot of worker shortages, is because their demands are not being met, even with their unions, right? So it's people are inherently going to go to where they're able to make the most money. That's just how that is. If you want people to stay, you need to give them incentive to stay and reasoning to stay, and not go to other provinces, right? Like, don't get me wrong, I do want people to stay in their respective provinces and help out their communities, but that's kind of hard to do when a lot of the premiers are not willing to come to the table to negotiate with the healthcare workers, and like essentially putting like fucking like deals on the table that they essentially have to take, or sucks to suck, right? Because we saw that in Ontario, and we're seeing that in other countries following suit after Doug Ford, or after what Doug Ford did. He said the NDP isn't ruling out pulling its support for the government or the government's deal, that it's keeping the Liberal Party in power, but for now, the party is going to focus on trying to force this government to act, as doctors warn that children's hospitals are under severe strain. That is also true. We have covered that extensively on the broadcast. Yeah, it's complete, and it's like not even just children's hospitals. Like it's just the hospitals in general. There may be a time when it becomes clear to us that the Liberal government just is not willing to do what's needed to help people, and we reserve the right to withhold our support, Singh said. I mean, yeah, that's true. I think that's even more true in amongst conservative governments. Like, at least liberal governments will provide some form of funding towards the healthcare system, and not just cut everything like conservatives do. And like, to be perfectly honest, if NDP was to roll federally, I don't really think that they would go far enough anyways, and like actually put their foot down and tell these dumbass conservative premiers, be like, you're going to be spending all this money on healthcare. If not, you're going under investigation. I honestly think that we should 100% put every single conservative premier that is, or just any premier in general that is not funding the systems that they've received money for, they should be 100% be put under investigation. Like, no questions asked. Prime Minister Justin Trudeau announced the supply and confidence agreement with the NDP on March 22nd, telling reporters it would be in place until 2025. Though either party can back out at any time. Under the deal, the NDP has agreed to support the Liberals in confidence votes for that period of time in exchange for progress as on specific files. Singh told Stephenson he understands the ramifications on withholding his support, a decision that would cause the government to fall and likely trigger another federal election. which I honestly don't think anyone wants. Like, even I don't fucking want another federal election. Like, even like at this point, like seeing like polling and everything, like it's there very well could be like a pure Polyev government, and that would just be fucking awful. I still think that the liberals will win over the conservatives just because of how fucking psychotic your Polyev is. But like at best, like if conservatives did, I think they would have a like just barely eke out a minority government that will get absolutely nothing done. Be fucking terrible for the economy as well. But right now, our focus is on fighting and not giving up on people, he said. Speaking Friday, Deputy Prime Minister and Finance Minister Chrystia Freeland acknowledged that Canadians are feeling frustrated and frightened by the situation in hospitals. Yeah, of course, there definitely was. Or people are feeling that way 100%, and rightfully so. Pressures such as overcrowded emergency departments and family doctor shortages are leading to strained healthcare system across the country. Hospital ERs are facing patient surgeries from 3 different rapidly spreading illnesses: the flu, respiratory syncytial virus, RSV, and COVID-19. Premiers have been demanding a $28 billion increase to the Canada Health Transfer, which they say will bring the federal contribution towards health costs from 22% currently to 35%. I mean, I don't even disagree with increasing the amount of funding going towards the healthcare system. However, as we've discussed and seen time and time again, the conservative premiers just don't want to spend that money on healthcare. Like, I imagine, like, some of this, like $28 billion that they are asking for, would probably go towards healthcare, but a vast majority of it will not. Like, let's be real, right? Like, we've seen them time and time again underfunding to increase privatization of healthcare. Why else would companies like, say, what was it, like Loblaws and TELUS start investing into drugs? Like, what does groceries and telecom communications have to do with healthcare? Absolutely nothing. It's just to make more money. And with conservative premiers literally showing that, you know, they're okay with that happening, like, it's frustrating. Speaking in a joint press conference on Friday, the premiers called for an urgent meeting with Prime Minister Justin Trudeau to hammer out the details on healthcare funding for the spring federal budget. But Freeland said Friday the federal and provincial governments need to find solutions rather than focus on dollars. I do also agree with this, right? Like, it's not like the federal government hasn't been giving them enough money to actually, like, maintain and in some instances even improve on healthcare services. They 100% have. We understand that Canadians are really worried and frustrated and frightened, actually, in many parts of the country about the state of the healthcare system. We know that we need to work together to make it better, Berlin told reporters during an event in Toronto Friday. Yes, it does mean some more investment, but it also means a focus on being sure we get the results that Canadians quite rightly expect of us from those investments alone, end quote, which is true. The NDP also does not support the Liberals' proposed amendment to Bill C-21, the planned gun reform law, Singh said in an interview with Stephenson. Yeah, it's pretty psychotic. The fact that they're banning like hunting rifles and shit is just completely psychotic to me. I mean, like people need to have or some people hunt. You know, some people hunt, some people need protection from wildlife. That's just the way it is. And I think it's just silly that that's they're trying to get rid of that, right? The Liberal amendment has been facing questions about how far it will expand the scope of weapons that are prohibited in Canada. The move promotes blowback from numerous hunters, including Montreal Canadiens star Carey Price, who called the proposal legislation unjust. We don't want to see any laws that breach the treaty rights of Indigenous communities. Those treaty and inherited rights to be able to hunt and to provide for their families and live a traditional lifestyle, Singh said. So those are concerns we have raised, as well as we understand the needs of hunters and farmers to be able to continue to do what they do. And so we've raised concerns about the amendment, but we're united as a party. The NDP supports the bill overall, Singh said, but his party would have a problem supporting the proposed amendment to the bill when he said will be fixed. Once it's fixed, we'll take a look at it, he said. Walking into a cabinet meeting on Thursday, Trudeau confirmed he has no plans to drop his legislation push to enshrine a legal definition for assault-style firearms, a term that isn't currently defined in Canadian law, despite it being regularly used by Liberal politicians. Automatic assault weapons are already prohibited in Canada. The definition is something that we are very much committed to, but the actual list that goes with it, that something that we're consulting on right now, Trudeau told reporters. Because we understand that there are concerns by hunters and farmers that we're going after their shotguns and rifles. We're not. And that's what we're going to make sure with fine-tuning the legislation. And I am Liberal NDP and Bloc Québécois MPs requested an urgent meeting of the House of Commons Public Safety Committee last week to hear testimony from witnesses specifically on the amendment. A meeting to discuss that request is expected within days. So, I mean, I guess we'll have to wait and see what comes out of that. The The New Democrats are ready to withdraw from the confidence and supply agreement they signed with the Liberals if there's no federal action to address the healthcare crisis. NDP leader Jagmeet Singh said on Monday. The deal reached in March committed the NDP to support the minority government on key votes in the House of Commons that avoid triggering an election before 2025. In exchange, the Liberals have promised to make progress on a number of NDP priorities, including healthcare. While some terms of the agreement are very specific, the accord on healthcare involves additional ongoing investments, but offers no timelines or specific dollar figures. If we do not see action on healthcare, we absolutely reserve the right to withdraw our support, Singh said at a press conference Monday in Ottawa. This is at the level of seriousness that we could make the serious consideration. We need to see action. In a year-end review with the Canadian press later Monday, Prime Minister Justin Trudeau said he is ready and willing to offer provinces more money for healthcare, but he wants to know the government will see improvements in the system as a result, which I don't blame him for. As for whether Singh will pull out of the deal, Trudeau said the healthcare crisis is greater than any agreement with the NDP. I think if healthcare continues to be such a crisis point for so many Canadians, an arrangement with the NDP is the least of our worries, Trudeau said. Unless we get improvements in our healthcare system, Canadians are going to start losing confidence in our country, in our institutions, in our ability to be there for each other. Singh, he said, he is particularly concerned about the escalating problems in children's hospitals across the country. He has called for an emergency debate in the House of Commons as hospitals deal with an influx of sick children. We're at the breaking point, Singh said. Our children are at risk now. Just last week, CHEO, the Children's Hospital in the Ontario region, or Ottawa region, called in support from the Canadian Red Cross to bolster staff who are treating record number of babies and children with respiratory illnesses. Meanwhile, in Alberta, Children's Hospital in Calgary is using a heated trailer as an overflow waiting room to accommodate young patients. Singh wrote to the Speaker of the House of Commons to give notice of the NDP's request for an emergency debate, citing these examples and other developments across Canada. A memo from the leadership of the BC Children's Hospital obtained by the Canadian press shows the hospital has reported to putting 2 patients in to a single room because of the number of children who need care. Similar measures have been used in the past during bad seasons of respiratory disease. Singh argued urgent action by the government on the crisis facing Canada's children's hospitals should be informed by a debate in Parliament. The House was adjourned early on Monday in recognition of the death of Winnipeg MP Jim Carr, and so the Speaker has not yet addressed the request for an emergency debate. Singh said he wants Trudeau to meet with provincial and territorial premiers to find a solution. I honestly don't think he's going to find one, to be perfectly honest. Last week, the premiers publicly repeated their demand for a sit down with the Prime Minister to personally hammer out an agreement to increase funding for their healthcare systems, a demand they've been making for more than a year now. I mean, they just want more money for themselves. Let's be perfectly clear. They have a fuck ton of unspent funds that they're not willing to put towards healthcare. And it's kind of funny how every single one of these clowns that are crying about not having enough funding for healthcare is literally a conservative premier. Like, it's mostly been Doug Ford and Daniel Smith, but I've also seen fucking Scott Moe and Heather Stephenson, for example, cry about it too. The premiers reiterated their desire to see Ottawa cover 35% of healthcare costs across the country, up from the current 22%, by increasing the Canada Health Transfer. During his interview with the Canadian Press, Trudeau would not commit to meeting with all premiers as requested. He said he speaks to them regularly about healthcare, and ministers are actively working on the issue with their provincial counterparts as well. I do not think people care whether or not we sit down together. I think people care whether or not we can start fixing our healthcare system, and that's what I'm focused on, he said. Which, yeah, I do agree with that. Like, I honestly don't give a shit how they do it. I don't give a shit if they sit down. Like, there needs to be more spending with on the provincial level for healthcare, because they haven't been doing it, and that's what really pisses me off about this. Like, it's just more excuses for premiers and their cabinet and their rich fucking friends to line their pockets. Federal Health Minister Jean-Yves Duclos brought to provincial and territorial health ministers last month an offer to increase the Canadian health transfer in exchange for better data sharing between provinces and territories, but no progress was made. And, like, that's the wild thing, right? Is that, like, we've known that they were approached by the federal health minister for an increase in funding, right? And all that they asked was for better sharing between the provinces and territories, like the better sharing of data. But you have all these fucking morons who are in the premier position being like, oh, well, that encroaches on our fucking sovereignty or some bullshit like that. Like, honestly, just piss off. You were elected to do your damn job, and you're not fucking doing it. So do your fucking damn job. Singh said the conditions imposed the confidence and supply agreement on healthcare are deliberately flexible, but the NDP leader added he's not seeing any sense of urgency from the government. This is not just about healthcare transfers. This is about an immediate crisis that requires immediate action, and the premier or the prime minister to step up and show that leadership. I mean, to be fair, it also does fall on the premier's shoulders as well. If they would have adequately funded the um if they would have adequately funded the healthcare system, we would not have this problem to begin with. Like it's kind of sus that we're only seeing this now, or this crisis now, when pre when healthcare workers, whether it be like family doctors or nurses or other medical staff, are leaving their provinces to find work elsewhere that actually pays them better and provides them with better services overall, and like have better agreements, right? It's kind of it's kind of sus, right? I wonder why that is. All right. So there has been an increase in the avian flu that could potentially cause a problem here. So take a look.
From poultry on farms to flocks in the wild, global bird populations are being ravaged this year by a deadly strain of avian influenza. Across Canada, the virus has hit an estimated 5 million birds, with the highest levels of infection in Alberta and BC.
When it goes into a barn, within 4 days, we can see total mortality of all the animals within the barn.
The disease has struck more than 260 Canadian farms and production facilities, far more than any other year over the last decade.
I would describe the scope as explosive and sort of all-encompassing. I mean, it really is a huge problem globally and here in Canada.
So what changed in 2022? Scientists speculate this virus is starting to impact more species and gaining a new foothold in North and South America.
We've seen much more detections and widespread death in these very charismatic wild bird species. So, that's problematic for a conservation standpoint.
Humans also occasionally catch bird flu. BC health officials are even asking doctors to watch out for possible cases.
And this is for
That transmission is a concern for researchers like Dr. Cheyenne Sharif. He warns this virus may eventually evolve to better infect us, even spreading from person to person and potentially sparking a future pandemic.
This is the sort of worst case scenario that we do not.
And like that's the thing, right? Like experts have been discussing this for a while now, that with learning a lot, like with the amount of technology and everything that we had during the COVID-19 pandemic, experts are saying that the next pandemic could easily come from CAFOs because of how frequent these animals are traveling across the planet. It typically tends to be like one species of an animal, and it's very easy for those viruses to mutate. And who's not to say that it's not going to jump to humans, right? Like, we do need to completely rehaul the entire way that we do like meat production, or just agriculture in general, right? Because like we have to pump them up so much with vaccines and antibiotics that it's just completely ridiculous.
Want to happen.
Hey girls.
But there's no sign this strain is heading in that direction, at least not yet.
Fortunately, this virus has not had the opportunity to mutate itself and create the variants or subvariants that have that sort of capacity and potential for transmission to humans.
One tool that would keep bird flu at bay is a vaccine. Researchers are working to develop.
But we all saw how fucking well that worked with COVID, right? Like, it didn't work all that well at all. Like, no one, like, when it came to fucking vaccines, like, we had a bunch of fucking hogs that were crying about having to get a vaccine because they thought it was like fucking microchipping them or some dumbass reason like that.
Shots that could protect both birds and humans, but for now, there's nothing available in Canada. Lauren Pelly, CBC News, Toronto.
The French president is calling it a small revolution for prevention. As of January 1st...
Oh yeah, I think France is making contraceptives free, which is really good. Yeah, no, contraceptives should 100% be free. It's definitely a form of healthcare because, you know, it helps prevent the spread of STIs, as well as, you know, they should be just free to begin with. Like, people are gonna fuck, right?
In France, condoms will be available free of charge in pharmacies. This woman says it's a good idea and will help young people who have trouble paying. Now, the goal is to reverse two trends. On the one hand, use of contraception is dropping, while the number of sexually transmitted infections, or STIs, is growing. Some French health officials call it an explosion. Chlamydia cases jumped 15% last year. In fact, since 2015, they've doubled. France has already made condoms free for young people with a prescription, but it didn't appear to be working. This pharmacist says doctors weren't prescribing condoms often enough, and right now no one has enough money.
I mean, to be perfectly fair, this is a rare W for France. Like, it's such a good thing for the French government to actually do this. Like, this is really good.
Young people especially. Now, the battle against STIs is on here in Canada as well. Earlier this month, Atlantic provinces announced an initiative to make STI testing more accessible. They'll be available at pharmacies. It's a growing problem in this country as well. Over the course of a decade, from 2010, chlamydia cases jumped about 60%, gonorrhea by about 175%, and...
I do think that a rise within the the STIs as well does have to come from, like, psychopaths being like, hey, sex is bad. If you have sex, you're gonna go to hell, right? Like, it doesn't fucking matter. Like, even if you're like a fucking teen, people are still gonna fuck, right? So it's better to, like, teach them about safe sex and, like, the ways to prevent, like, say, pregnancy or the transmission of STIs, and, you know, like, what the fuck to do. Like, this opens up, like, a gigantic whole entire conversation that I don't really think I should have currently, because I'm currently covering other stuff, but it definitely is a conversation that I have had on the broadcast before. Yeah, it's just, you know, we need to, you know, just have better sex ed and have contraceptives free, as well as abortion.
Syphilis by close to 400%. Alex McKay is with the Sex Information and Education Council of Canada.
Sexually transmitted infections have always been a much more significant threat to public health than much of the population realizes.
McKay
He's
says
right.
The pandemic likely made the problem worse. There wasn't as much STI testing, and the more undiagnosed infections in the population, the easier STIs spread. McKay points out the French government is also focused on sexual health education.
The French are already ahead of, in many respects, ahead of where we are. So that's another area that we need to focus on.
Bro, imagine getting fucking literally comstered by the French. Like, bro, we're fucking awful, man. Like, we're fucking losing to the French. Like, how, like, that's so sad, right? Like, they don't have any fucking problems with funding of healthcare and, like, a bunch of idiotic back and forths between local and, like, what is it, like, I imagine it's like provincial jurisdictions with when it comes to, like, healthcare spending and everything. Like, It's silly, and they're fucking steamrolling us on this too. God, we're so fucking bad. I swear to God, we are America too.
There has been some criticism of the free access to condoms policy in France.
Yeah, you want to know where that criticism's coming from? Is literally coming from fucking conservatives. They're literally crying because, you know, people are gonna be having sex, and you know, they're just fucking crying about it because they can't get any fucking pussy from their wives that they abuse when they come home. Like, it's just idiotic. Like, this is a very good thing. This is a huge W for them.
Some argue the government should be worrying about bigger priorities. Mike Armstrong, Global News, Montreal.
I mean, it is a form of healthcare, though. Like, anyone who, like, disagrees with that is a fucking moron.
In West Kelowna, BC, an entire community is in mourning. 9-year-old Isla Lawsett passed away in late November from an infection related to the flu. An infection Isla's family believes wasn't recognized by doctors until it was too late.
Our little Layla's gone, but if by her passing something can change to help it doesn't happen to anybody else, that would mean a lot to my little baby.
Canada's National Flu Surveillance Network is reporting 5 pediatric deaths so far this season, but that number will soon rise with more up-to-date provincial numbers.
What the fuck? Yeah, of course, Saskatchewan hasn't shared any of that because I remember hearing, I think it was today, that the government of Saskatchewan wasn't keeping, like, or wasn't, what was it? I believe it was like the institution that was responsible for keeping track of like COVID numbers and everything, like to have them up to date and like give the reporting to, or the Saskatchewan government giving the reporting to the to said institution. Like all that they had asked for was the data for sewer water rates for COVID, and the government of Saskatchewan did not give it to them unless they were willing to hand over their papers, so that the government of Saskatchewan could review it. Because we all know that like Scott Moe's government is doing a fucking shit job in Saskatchewan, right? So it's not surprising that you know, pediatric flu deaths is not counted here either for Saskatchewan.
Suggesting that at least 10 children have died from flu-related illness.
And like 10 is too high, right? There's no reason why it should be this high. Absolutely none.
Yes, so we should be alarmed and we should try to do everything we can to reduce the numbers. The concern is you've had 10 pediatric deaths, and this is still very early in the flu season. And so, you know, we still...
The crazy thing is that it's going to be getting worse. Because we know the current situations amongst a lot of different provinces, and it's really frustrating that this shit is happening, and that unfortunately there's going to be a lot more deaths that are easily preventable because of political reasons.
Have several more months to go.
COVID, flu, and RSV have hit children hard all at the same time, leaving pediatric hospitals struggling to cope with the worst season since H1N1 first struck in 2009.
I think that this is the busiest I've ever seen it. We're seeing larger numbers in 2009 and certainly far exceeding what we see most years.
At BC Children's Hospital, staff are preparing for the possibility that single rooms may soon need to accommodate 2 sick patients instead of 1. The onslaught of illness has already forced pediatric hospitals across the country to cancel surgeries and redeploy staff.
What I find upsetting is that it's a vaccine preventable disease and that we've had
Easy.
up until now low immunization rates in children.
Public health officials are urging parents to get their kids vaccinated against the flu as
Keep in mind, a vast majority of these deaths are preventable. And a vast majority of where these deaths are happening are coming from provinces whose premiers and cabinets claim to care about children. But as we see time and time again, when children are literally dying, they don't even lift a finger. They only use children as a political tool. It should be disgusting to literally anyone who has like at least a small amount of empathy. Like, it is absolutely fucking disgusting that this is a problem to begin with, just because a few fucking morons want to play politics just so that they can have a little bit more money in their pocket. Like, it should be disgusting to literally anyone, or literally everyone.
soon as they can. Masking is being encouraged too. While there are signs.
Yeah, masking for certain individuals. Like, we already know that the fucking premiers won't be doing anything for the province or the children. Like, they essentially fucking removed every single requirement for and mandate for masking. So yeah, it's just great. It's just fucking great. What? Who is this? I have no idea who you're referencing.
That the flu season may be peaking in parts of the country, the virus is still very much a threat, with hospitals bracing for some very difficult weeks ahead. Heather Urix West, Global News, Calgary.
Okay, let's move on to the interview that Jagmeet Singh had with Global.
I have friends, colleagues, members of
Was it Global or was it CBC? I don't remember.
Hospital who cry before they come to work, cry when they leave work. Because
Mongolian uncle.
the
I didn't know that.
are so high, they are not providing the care that they were trained to give. We are morally injured, and it cannot continue.
Canada's healthcare crisis is coming to a head on Parliament Hill. NDP
I'm a Mongolian uncle. Why is that?
leader Jagmeet Singh calls the federal government's response so far as, quote, deplorable. He's demanding Prime Minister Justin Trudeau sit down with the premiers to address the immediate crisis, and he's not ruling out withdrawal of NDP support for the Liberal government. NDP leader Jagmeet Singh joins me now. Mr. Singh.
Luscious Lux. Hell yeah. Thanks, man. That makes me feel a little bit better.
Thanks for coming in.
Thank you.
The Prime Minister has yet to sit down with the premiers, but he sat down with you this afternoon, I understand it. Did he give you any assurances on healthcare that make you more comfortable than this morning when you spoke?
We raised a concern. I wanted to
Took 4 years to grow up, by the way.
And we put it on clear notice. We put the Prime Minister on notice. I put him on notice personally that this is something we need to see action on. In 2020, it was our seniors in long-term care that bore the brunt of the pandemic. The military had to get called in. Now this is early, in December, with the early season of the respiratory diseases that we know happen very often in this season. And already the Red Cross has been called into Ottawa, the nation's capital, in the healthcare, in the Children's Health Hospital. In Alberta, we have trailers set up to deal with the overflow in the Children's Hospital. Children are dying. It is serious, and it's only going to get worse. So I made it clear that we need to see action. We need to see federal leadership.
Indian.
Did he give you any indication that there would be federal action forthcoming, or meet the bar of leadership that you're demanding?
So far, I put him on notice, and I did not, at this point, receive what the action will be. But I made it clear that's what we're looking for. We need to see action.
If they're so absent on this, I mean, why threaten to withdraw support for the agreement? Why not just do it if they're doing such a bad job on healthcare?
When I look at that question, I think about what it means is giving up. And I'm a
Keep in mind, a lot of this healthcare crisis is coming from the provinces and the premiers. Vast majority of it is not coming from the federal government.
fighter. We're 9 months into this agreement. We've used it to get significant victories for people. And I don't want to give up now. I want to keep on fighting. There may come a time after we've exhausted all of our efforts of fighting, we've raised concerns, and there's simply no action on the part of the government. Then that is an option that we have. But at this point in time, we're fighting. We're using our power to get this government to deliver on the leadership that we need to see happen for people to get the healthcare they need, particularly our children right now. And that's what's really heartbreaking about this. It's children that are bearing the brunt.
Yeah, but you've put them on notice. You know, my whole life when I've been put on notice, that comes with a deadline. So what's the deadline here for Prime Minister Justin Trudeau to live up to the standard that you're expecting him to live up to in this healthcare crisis?
Well, we let him know that this is what we're expecting, and the ball is now in the Prime Minister's court. We're going to continue to share the stories that we're hearing from people and continue to fight to see some action happen. It is insufficient that the current response is the premiers want money with no strings attached. The Prime Minister wants to put strings, and we have.
I mean, like, he wants to put strings on for very good reasons, though, right? Because historically, like, a lot of these premiers that are crying about not having enough funding for healthcare literally did not spend like almost any of that on healthcare. Like, it's understandable that he wants a commitment that the premiers are going to be spending money on healthcare.
Support.
So I can't necessarily say I fault him for that.
Towards healthcare, and there's some serious concerns around premiers like Daniel Smith and Doug Ford who will use the money to privatize healthcare. So I understand that. But to a family right now that is worried if their kid is going to be able to get looked after, that is not an answer that gives them any solace.
I understand that, but I guess that then goes back to my point that the need is now, the crisis is urgent, so that makes it time sensitive. So putting the Prime Minister on notice means what exactly if there isn't a deadline by which action is required when you follow through on what you threaten him with here?
We're letting the Prime Minister know this is important, and we're raising the stories and concerns of people.
He knows that it's important, don't you think? I mean, he must know. He hears it from his MPs. They hear it. I mean, he hears it on the news and from the premiers. I mean, he knows it's important. I guess the question is when does he need to act by?
Our priority is to get results. And we've been told in the past no when we put something forward. And for example, in May, we said Canadians need some extra help, and we suggested increasing the GST rebate. The Prime Minister's answer at that time was no. The Conservatives came out opposed to it. As of the 1st of December, or as of November in 2022, Canadians started receiving twice what they received in terms of their GST rebate. So we didn't give up fighting. Similarly, right now, we're at the beginning of this crisis. It is the beginning of the season, and things are only going to get worse. We've raised this as a serious concern, and now we're letting the Prime Minister know we expect action.
What they're looking for, the conditions that Minister Duclos has been the main spokesperson on, these are all baked into the agreement. I've got to hear that you signed with the Prime Minister on the confidence and supply agreement. So, you know, wanting mental health support, aging at home, better data, this is one of the sticking points in the conversation. So that's part of the agreement you signed on for. So do you support the federal government in holding on to these conditions and expecting progress on those key areas from the premiers in return for billions in extra money?
We've always said that if we spend money, Canadians expect us to know where that money is going.
Why can't you just say yes? Like, that is a very good proposal if they want extra money, right? Like, come on, just say yes, man.
The idea that it should be going towards clear outcomes, better improved healthcare delivery is something that Canadians expect is reasonable, and I agree it's reasonable. But what I don't think is reasonable is in the face of a healthcare crisis where children right now are bearing the brunt of it, with children's hospitals across the country at breaking point situations, overcapacity, in Montreal, in provinces across this country, in Toronto, in the capital city of Ottawa, in Calgary, places where I visited. In that point, when we've got such a serious crisis in our healthcare system, what we expect is some immediate action to deal with that problem. That's what we're looking for.
So what does that immediate action look like? Because the federal government is one part of this conversation, and there are 13 provincial and territorial premiers on the other side of it, and they have been asking for money without conditions for years now, and kind of torpedoed the health minister's meetings that were happening in Vancouver by putting out a news release before it was over, saying it was a failure. So I mean, what does meaningful action look like here, and how do you hold the Prime Minister to a standard if you don't also hold the premiers to a standard, I guess?
He's 100% right. Like he's not discussing the conversation surrounding the premiers, because we know that the premiers are essentially responsible for the healthcare system within their respective provinces. If they don't spend the funding that they get to the respective in their respective provinces for the healthcare system, it's going to be a big problem, and we're going to end up with more situations like this.
Well, we certainly agree that the premiers aren't doing their part. There's no question about it. We've got premiers that are failing, abject failures. Doug Ford is a failure. Daniel Smith's been a failure, and we see that they have money that they could be spending on healthcare, and they're not. And there's no
Scott
question about
Moe,
it.
Heather Stephenson.
They want to privatize the healthcare system, knowing that it is wrong to sit back and watch that happen. So what we're saying to the Prime Minister is, we saw.
Then why don't you put your foot down with the Liberals, or why don't you put your foot down and be like, hey, there are some things that are very important that a lot of Canadians would agree is important, and it's up to you to make sure that the premiers are spending money responsibly, because they're clearly not doing that, right?
Immediate action in the pandemic, steps taken that went beyond what we normally expect a federal government to do, because
except here's the thing with the pandemic though, right? You had a bunch of mouth-breathing hogs that were like, this oversteps my fucking freedoms and whatever else, right? And a lot of people will lose their shit if, the same course of action was taken. Because we've seen, generally speaking, people are like willing to like mask up, get the vaccine, et cetera, et cetera. But people are not, or you have those who are willing to spread misinformation, who are willing to like resist it and like pay the fucking fines because they have absorbent amounts of money, and just not give a shit overall, right? I honestly think that if we were to follow the same steps for COVID, I don't think it would go over too well with a good majority of Canadians, even liberal Canadians, to be perfectly honest.
It was such a serious time, the federal government stepped up. Similarly, right now, imagine the early weeks of the long-term care crisis, where seniors were found in such deplorable conditions when the military came in. They said this is worse than what we've seen in war zones. We're at the early stages of that right now, based on what nurses and doctors and frontline healthcare workers are telling us. We're at the early stages of that. We're just starting with the flu season. It's just early stages of that. It's early stages.
But like, you've seen how a lot of the provincial governments have been working, though, especially with like especially over the last couple of years. We don't act until it's too late. That's just how that is.
Of the respiratory illness season. So right now is the time to act, and we're expecting the federal government to step up the same way they did in the pandemic and come up with some solutions. We know that some of it's going to require using the immigration system to bring in healthcare workers. Some of it's going to require some immediate relief when it comes to making sure people can get medication over the counter, because a lot of people are going into the emergency room because they can't find medication to help with a fever or a cough with their child.
But during the pandemic, they were very responsive because it was a minority government, but it never had an agreement. It never had a partner. So the political pressure was issue by issue, day by day, for the federal government to act. Do you think some of the pressure has been taken off them to respond to this crisis in an urgent way because they have this agreement with your party to keep them there until 2025, as long as dental and other things keep moving through the legislative process?
Not at all. It gives us an increased lever. It gives us more access, and it gives us more power than ever before. It doesn't mean that the government fail to deliver what they promised to, and we've seen that happen in the past.
Mm-hmm. I mean, that happens consistently, though. Generally speaking, a vast majority of governments will fail to uphold campaign promises and actually meet the requirements.
but we certainly have more power now and more influence now than we've ever had before, more access to the ministers and more access to the Prime Minister to get them to do what's needed. But at the end of the day, the Prime Minister is still the one who has the final decision maker. That's who Canadians elected. And so we're going to put pressure on them and on the Liberal government to act. If they fail to act, it's on them.
Okay, but you've put them on notice, but without a specific deadline, and you say you want them to act. What are the specific actions? I mean, a meeting with the premiers doesn't necessarily guarantee that something gets fixed in healthcare.
True.
So given the jurisdictional splits in the country, what is it you want to see the federal government do right now?
He's right. You know, if there was like something to, like if there was like a meeting and sit down and everything, like he's completely right about that. That doesn't necessarily mean that it's going to be solved, because we've seen time and time again with these fucking hogs that they're not willing to actually, you know, fucking make any compensations or whatever in order to like actually have things fucking rolling. They're too busy, you know, destroying democracy for that.
Satisfies your call for an urgent response.
So the main concern that we've heard from healthcare workers is there's a human healthcare resource shortage. So meaning there's not enough healthcare workers. So
I wonder why that is.
One, we need to make sure that anyone in this country that has international training should be working in that field. And so to unlock that, there's a federal aspect of that. Many of the exams are national in scope for healthcare workers.
But a lot of that's provincially regulated or professionally regulated.
And there's
right?
a provincial element as well. So we need to see the federal government step up and find solutions so that these workers that are brought to Canada, that are trained internationally, that have experience, that their potential is unlocked, find a solution so that they can actually start working. Secondly, the Prime Minister made some...
I wonder what would actually solve that problem. I wonder. It's totally not like we've discussed solutions for that problem. And very similar problems when it comes to like education as well. Wonder what solves that problem.
Big promises around making sure healthcare workers got better pay. He made a promise around personal support workers, for example. His commitment was to make sure they were paid appropriately. We want him to fulfill that promise because we know good pay will help deal with the healthcare shortage.
But that has to be done through the provinces, right? I mean, they provide the health
He's
services.
right.
That has to be done through private employers or government employers.
All that comes down to provincial. The one aspect I think Singh is missing here is that a vast majority of the problems when it comes to healthcare that he's completely overlooking and just wants something to attack the Liberals on is that a vast majority of the things that he wants done fall under provincial jurisdiction, right? He's essentially just using this issue as a talking point in order to attack the Liberals. Which, yeah, the Liberals, I do agree that the Liberals aren't doing enough, but there is also that aspect of the premiers not doing enough in order to actually meet the demands of the citizens of their province, right? And we've seen that from coast to coast. It's a problem that faces like all of us. And the fact that the premiers are not willing to invest money into hospitals, invest money into the workers that run the hospitals, whether it be doctors, nurses, other staff, you know, it doesn't matter. A vast majority of that comes down to the premiers. It's not like they're not given enough money. They 100% are given enough money. And then some, probably, for things like mental health issues or dental. Like, that isn't a problem. Like, money isn't the problem here. It's the reallocating of funds in order to undermine the healthcare system so that they're able to privatize it. That's what the main issue is right here. And I don't understand why Singh is overlooking that aspect of this. Like, yes, I get that the Liberals have been pretty fucking terrible, but it's a problem that we it's a problem that we can't necessarily avoid. We need to have a discussion about that, because that is realistically the biggest problem that we are currently facing. Is that it is the not enough funds going, like, actually going towards it, and and premiers not spending the money that they were given on their healthcare systems and healthcare workers. Like, we need to be talking about that aspect as well.
At the provincial level, and even accelerated credential processes is not going to solve the staff shortage for the current cold and flu season in a meaningful way.
Well, in terms of giving some additional supports, financial supports to get people working, we know that we've had tools to do that. There's ways and there's suggestions around tax credits to support and incentivize healthcare workers, those that have left the profession because they're not able to make ends meet, because they don't have enough resources working in that field, personal support workers who've left the field because they say we're not able to earn a living. There's ways to use the federal system to find some immediate ways to provide financial supports. We've done that before through CERB. We were able to give money directly.
Well, yeah, but that's, for one, that's only a band-aid solution, right? It's not going to help people out in the long run. And for two, a vast majority of people had to pay back this the amount of money that they received from CERB that they can't afford to. Like, at best, it would be a band-aid solution. We need a clear and decisive action that would be permanent. And we all know what that clear and decisive action is. It's to fucking whip the premiers in order to get them to actually do what they were fucking elected to do. Like, it's so frustrating, man. Like, even like idiots down the street from me know what the fucking solution is. Like, it's not rocket science. Like, the Trudeau government has been very generous with the amount of money that they've been giving towards healthcare to the provinces. They just haven't fucking spent the money that they were given for healthcare on healthcare. Or if it was like, to try and privatize it.
To people. Right. So we need to find a way to support personal support workers. We need to find a way to support healthcare workers on the front lines, and we need to do it in an emergency. When we're up against an emergency, I don't think leadership is to say, well, there's all these barriers and all these excuses. I think it's finding creative solutions in a time of difficulty, and there are ways we can do that.
Just one last question. If you do follow through on the, I'm going to call it a threat, maybe it's too strong a word, to potentially pull your support over this, are you talking about trying to force the country into an election, or are you talking about going back to the issue-by-issue parliamentary setup that existed prior to the confidence and supply agreement?
Well, we're leaving the door open. Our choices, we have many different choices in terms of the way we exercise that. It could simply be exiting, or it could be a confidence motion, but that's not our goal. And that, I want to be very clear. That what we're looking for right now is to use the power we have to fight for better response to this healthcare crisis, and to force this government and force the Prime Minister to act. That's our goal, and that's where we're putting our emphasis. We, of course, have the ability to do a number of things in terms of how we...
I mean, he has been, like, acting, though, right? It's just that the premiers are not actually wanting to commit to spending the funds or spending the extra funds that they're demanding in order for the healthcare system. They're not willing to commit that, which is why we're getting absolutely nowhere with this.
Use our or withdraw.
And like it also doesn't matter, because like even if he does increase healthcare spending to 35%, like these hogs want, when it comes down to the next election cycle, they're just going to be fucking crying about the Liberal government spending too much money again. That's just how that fucking works, and it's incredibly infuriating. Like, why can't you see that? Like, it's just common conservative politics 101.
And we can look at those tools. But right now, our goal is to say this is serious, and we need action.
Okay, Jagmeet Singh, thanks for coming. Always good to see you.
Thank you.
Oh, it's so frustrating, man.
Sarah Ryan is a mom of 2 in Kamloops. She has used 18 sick days this year to care for her kids and doesn't have any left.
I think it was October when my kids were sick. I was ready to just quit everything, quit my job.
She says both her kids have fallen ill with COVID, the flu, and RSV.
My day.
Damn, bro, all 3? Fuck, that's scary, man. I would not I'm speechless. Like, all of this shit was preventable. And the fact that no one is willing to actually fucking step up and be the bigger person in order to protect our children is fucking ridiculous.
Daycare has still a 0 symptom policy because it's a home daycare. So if the daycare owner gets sick, then she has to close the daycare.
This pediatrician says in the current climate, any flu symptom is enough for a child to stay home.
Even when they've got a new, just new runny nose and sore throat where we know something might be in the mail. Because we're seeing that doctors' offices, emergency departments, hospitals are all full of children.
But keeping kids home isn't always easy for some. Labor experts say women are more likely to stay home to care for kids than men, and some who do not work in jobs that permit working remotely face extra challenges.
In particular, women
True.
in the service sector and in frontline services. And so that may well require taking unpaid leave in order to care for children.
The BC Federation of Labor is calling on the province to offer more paid sick days amid a surge in respiratory illnesses.
Folks shouldn't have to choose between going to work and feeding their families or paying their bills, right? And that is, currently the situation. 5 days doesn't go very far if you get a COVID diagnosis.
The province currently offers 5 paid sick days to eligible employees. The BC Federation of Labor is hoping to up that to 15. But parents like Ryan say that's not nearly enough.
I've used 18, right? So 5 is
This parent
I mean, yeah, like, that's the common theme for a vast majority of Canadians overall. Like, it's just the sad reality of it.
Hanging on and hoping her kids manage to dodge more illness. Yasmin Gandam, CBC News, Vancouver.
Senior health reporters Christine Birak and Lauren Pelly, you have both been ahead of so many health and medical science stories this year. We need you to keep looking ahead. Christine, let's start with you. What's your sense of what will be the dominating health story next year?
I just had a doctor tell me, Christine, these are the final days of the Canadian healthcare system as we know it. It is collapsing. Is that an exaggeration? Maybe. But Lauren and I have spent a lot of time in emergency rooms and doctors' offices, and we can firmly say that they are short-staffed and there is a flood of patients. It is unprecedented, the crush inside our hospitals, and it really does feel like the healthcare system is dangling by a thread and something's got to give. And what we're hearing from the provinces and the premiers is that give is money, and they want it from the federal government, and they don't want any strings attached to that money. Ottawa and the federal government is saying, well, listen, there's money, but we want accountability. We're not writing blank checks. We want money for mental health. If you say you're going to bring down wait times in ERs, we want to see you do it. We want to see how this money is spent. We want health data so we can fix the system as we go. And stuck right in the middle is the medical community.
So if the conversation is we need money now, where does that put the conversation about private money, private healthcare?
That is
Oh no.
$1 billion question.
Oh no. Fuck, man. Oh, I hate this conversation so much. Private healthcare leads to worse results and an increase in money that taxpayers have to pay for healthcare. Ask any American, for the most part, on if they like spending what is it, like $10,000 to have a baby, for example. Ask any American if they enjoy spending exorbitant amount of fees that for the most part they do not have for their healthcare. A vast majority of Americans will say no, that is awful. And the fact that we are having a discussion on private healthcare should be raising a lot of alarm bells for people. Like, it's incredibly scary that we are having that conversation. It is a conversation that we should not be having at all.
I think that the conversations that happen and the money that gets spent is going to shape our healthcare system
I
for
hate her.
decades to come.
I hate her
it's
so
about to
much.
happen, and we'll see whether that money makes our system a more equitable public system that runs better for
It won't.
everyone,
It won't.
or it'll become more of a user-pay private system that
It will literally become the American system, and no fucking Canadian wants the American system. The American system is complete dog shit, and Americans, regardless of which party they vote for, also recognize that it's dog shit. Here's the thing. Medicare for all in America is incredibly popular across party lines. I think it's like 85% of Americans actually support like a Medicare for all form of legislation, right? So no, I don't want an American style system, nor does literally any other fucking Canadian outside of like some mouth breathing hogs that it won't affect anyways. It will only fucking marginalize communities that are already struggling with medical biases and medical racism, as well as it will make things significantly worse for outcomes, because when it comes to healthcare, or when it comes to like any company that's driven by the profit motive, they're not there for the patients, if that makes sense. Their entire thing for putting profits over people is they're reliant on their CEO and their shareholders. They want to make as much money as possible, right? So what they will do is they will charge absorbent amount of fees just to even like go see like your family doctor, for example, and charge you at the ass for that, as well as, you know, do a lot of surgeries and shit that are incredibly easy to do that will make them the most amount of money as possible. They won't necessarily do surgeries that are incredibly complicated. They would rather do the gravy surgeries that make them the most amount of money as they can. And the fact that the quality of care goes down when you have the profit incentive behind the entirety of the system, it is completely idiotic. Like, yeah, it's pretty fucking bad.
Is sped up for some people, and it very, very well may depend on where you live. But at the same time,
Also, another thing. When it comes to the profit-driven healthcare model, a lot of rural people in America struggle with getting adequate care because no fucking doctor wants to go out and live in a rural area where they're not making as much as if they were compared to in the big cities. So we're you should expect quality of care to like drop significantly for rural Canadians. Like it's it would just make things even fucking worse than what they currently are already.
There is a silver wave of patients that we've been talking about, boomers coming into the system. We're watching what's happening with kids right now, and the system has to change. And we all want it to be there when we need it.
So the shifting.
Yeah, but you're not changing it for the better. You're changing it for the worse, though. If you introduce private private companies that are responsible for providing medical services. Like, what? Who is this person? Is this the person? Take a look. Her. I don't know.
Graphics, Lauren. This worry.
It's Lauren, right?
About an aging population. What does that change about healthcare in 2023?
Well, let's put.
No, that's not Lauren. It's the other person. It's Jean. Take a look. Not really able to find too terribly much. Let's see. Let's see. I imagine she probably has some incentive to privatize the healthcare system because she probably has like some investments in stocks and bonds for the either TELUS or Loblaws. Not really finding too much on her. So
that in perspective. So the figures Canada is using is that the 85 and up population, that could triple in the next 25 years. Triple. So that's a lot more seniors in this country, people who actually use healthcare the most. Those are the people who are the most vulnerable to issues like flu, to COVID-19. Those are people who need to have, supportive housing around them. They need home care. They need long-term care beds. One of the big pressures in our healthcare system for many, many years now has been alternate level of care patients. And that's a term hospitals use for those people where they shouldn't be in a hospital, but there's just nowhere else for them to go. So this is sort of underpinning this whole conversation is we have all these immediate pressures on the system while our population is aging. How are we going to handle that in the decades ahead is a big question this country has to answer.
Sounds like you'll be spending a fair amount of your year.
It's not through privatization. That's not the way to do so.
Sure. On that, interesting. You said COVID-19. That's the first time this conversation came up. It hasn't gone away, but is it going away? Is it still going to be in the headlines next year?
There's two metrics that I keep an eye on. One is COVID hospitalizations across the country, and the other is COVID deaths. Unfortunately, COVID hospitalizations are rising, not just in Canada, but also in the United States, and probably will into the beginning of next year as well. And then there are deaths, and we are sitting at about 250 Canadians dying every week still from COVID. And we're on track to hit 50,000 COVID deaths in total, probably by the end of January. So that said, and that number is heartbreaking, Canadians have done a really good job.
Okay, but like privatization won't actually solve that issue, though. It just won't. Like, look at how fucking terribly the American system did for COVID. Like there were external factors that definitely went into that for sure, but the profit incentive did not help it. And like you already hear, like you hear about fucking hogs in America screeching about big pharma as is. So who's not to say that that won't happen here? Like it already does happen here. And and privatizing it will not help in the slightest when it comes down to that.
Comparatively protecting themselves and protecting the people around them. But like you said, COVID is not gone. It's not going anywhere. And we really have to make some decisions. People have to make decisions about how they're going to protect themselves going forward. And that's vaccines and public health measures.
One of the things we've talked about a lot is how COVID has been an accelerator for the good and the bad. One of the good things has been the attention, the money, the research into mRNA vaccines. Is it your instinct that we're going to see mRNA vaccines applied to a range of other situations next year?
Well, that's definitely in the works. And I think when you look at just the COVID-19 situation and how vaccines helped reshape the pandemic, one physician explained to me a while ago that the severity of this disease, while still bad, while still concerning, has sort of been knocked down a peg as we've built up that immunity. So companies are now betting big on mRNA shots. Moderna is trying to develop a universal flu vaccine that would target all the known strains. Other companies are working on vaccines against cancer, everything from melanoma to...
I mean, to be perfectly fair, though, Cuba already has access to a vaccine that helps reduce cancer, so I don't understand why we just don't talk to Cuba about that. Because, like, if Cuba's able to do it with all of the embargoes and everything to do so, I don't understand why we can't do it either. Or at the very least, talk with them. Like, who gives a shit if America doesn't like them? Like, honestly, who gives a shit?
Cancers of the throat, the head, the neck. All of this is a long way off. They still have to go through clinical trials. But if they have wins on this front, we could really have some amazing tools to beat back some really devastating diseases. Not just COVID, but more than that.
Okay, so we have 1 minute left. So just a quick whip around. Something that I don't...
The COVID vaccines were also a global collaborative effort, though, that that was unprecedented up until that point. So there's that aspect that you have to be taking a look at as well.
See coming, but you do next year.
Well, I think all of us have been, waiting for what will be the next pandemic, right? People are so nervous after watching COVID, but for me, I'm also watching all those other known threats because we've seen everything from fungal infections to STIs come roaring back in certain ways because of antibiotic resistance. We're seeing,
as well as lack of education, misinformation. That's a very nuanced conversation to be having. Like lack of education for a lot of that stuff, especially like STIs, doesn't help. If we were to like make contraceptives free, that would definitely help out with that. There's also that misinformation again, because like we saw how fucking bad the misinformation was when it came to COVID and the COVID vaccines, which led to less people getting vaccinated than anticipated. There's that as well.
Diseases like measles and cholera and polio, some things that people have never even dealt with in their lifetime, come back because of issues like vaccine hesitancy. So,
and anti-vaxxers, don't forget that as well. Anti-vaxxers have played a huge role in that, mostly because of a lot of distrust for the government that had happened, or that had happened over COVID-19.
All of these are familiar to us. Things like avian influenza exploded this year, and I'll have more on that later this week. But that's some of the issues I'll be watching. It's not just the unknown, but it's the familiar that I think will be a big concern for us going forward in 2023 and beyond.
Can you do it in 10 seconds?
Oh, gosh. Variants. We never saw Omicron coming at this time last year. I want to see where variants are heading. There's great surveillance that's happening in this country. We'll have a story coming up on it because we want to know, after Omicron in the Greek alphabet comes pi. Is pi coming?
Oh, no pie. No pie.
Hopefully it's just holiday pie we're thinking about.
Oh, just holiday pie, absolutely.
All right, Christine Bierek, Lauren Pelly, thanks very much.
Very well, thank you.
Okay. Yeah, let's talk about fusion, the fusion stuff now. So, for those who don't know, I believe it was in South Carolina, found a way to output more energy than what was inputted into it. So it's really exciting, but also we will be talking about how it could be terrifying as well. Because there definitely is some implications that are very scary about this for sure. So we will be talking about that, because it is something that we do need to talk about.
That powers the sun, harnessing it, the holy grail of clean energy. Nuclear fusion, long a reality on the silver screen.
What are you doing, Doc? I need fuel.
Powering everything from spaceships to time machines. Now, scientists at this lab say fusion is a step closer to the real world. Researchers here used lasers to create conditions similar to the sun, slamming hydrogen atoms together to create a fusion reaction. The breakthrough, according to officials, more energy was released than used in the process. Proof of life for fusion power.
Simply put, this is one of the most impressive scientific feats of the 21st century.
The potential environmental benefits of fusion are obvious. An abundant source of clean energy to help the planet kick its carbon addiction.
It's a game changer.
But I honestly don't think that it will, because if we look at how propagandized the entirety of the of current green energy initiatives were, like solar panels, you know, hydroelectric power, volcanic power, wind. There was straight up fucking lying from oil companies about that shit, right? And yeah, no, this is very exciting. Like it is another thing that we can use for, or another argument that we could be using for clean energy, right? Like putting in less energy and receiving more than what we out, or than what we had put in, is incredibly good. And to be perfectly honest, it's essentially like the equivalence of like discovering fire or the wheel, or something like that. Like this is huge, and I'm glad I get to live through the era where we actually can or we actually discovered this. Like this is very exciting news, and I saw a lot of I saw a lot of scientists excited about this as well. But the main thing that I have the main problem that I have with this discovery is one thing in particular. And it's actually sort of similar to what we had already seen in World War II. I am referring to the creation of weapons with this, because it's very, very reminiscent of what ended up happening with nuclear with nuclear energy. Like we had created weapons to kill each other with. And that's a big problem that I have currently with fusion energy, right? Like you already know for a fact that governments like Russia, the US, possibly China, will be using this discovery in order to maintain their positions of power on the global hierarchy, right? It's definitely terrifying for sure, but I do have hopes that it won't follow down the same path, but we never know. It could go one way or the other, for sure. And that is something that we do have to take into consideration, is the potential for weaponizing this. And it is something that we should be talking about, for sure.
Because it's dense, a very small area that it requires compared to, let's say, wind farms or PV.
Like wind and solar, fusion as a reliable source of green energy is the goal, but it's an elusive one. Many in the field joke that fusion power is just a decade away and always will.
I mean, it's not, though. We already have evidence that it's here, right? Like we always think that something's like far away, but it turns out we either had discovered that it's a lot closer than what we thought it was. And like it's exciting. It definitely is exciting that this was found. Like 100%. It's just that some ramifications can be incredibly terrifying.
And some worry that if this breakthrough is what fusion power looks like, it won't solve the climate crisis.
It took the energy needs of a small city to power up the lasers to produce for a fraction of a second a small surplus, about enough energy to boil a jug of water and make a pot of tea. So that's no solution to our energy
Oui,
needs.
bro.
Still, this latest discovery could lead to more funding for fusion research, likely the key to making fusion power anything more than science fiction. Aaron Collins, CBC News.
I mean, I don't even know if I believe that, though, because, like, the thing is that this easily solves a vast majority of our problems when it comes to energy, right? Uh-oh, squirrel's going off. It does solve a problem that we do have with energy, for sure. Like, if we're able to, like, let's say we're able to implement this into, like, I don't know, Toronto, for example, and fire up the energy required to produce the or to get the lasers going and everything. We could essentially indefinitely power Toronto for as long as we need without any necessary repercussions.
News, Calgary.
This is where we need Bob McDonald, host of CBC Radio's Quirks and Quarks. So, Bob, obviously I get this is an enormous moment, but could you help me out? What exactly just happened?
Well, Adrian, what they did today is nuclear fusion, which is different from the way we're generating nuclear power today.
And the thing is that this fusion energy is essentially what the star does. So we could easily I'm sure we could easily find a way in order for us to use this in other applications.
Today we take atoms and we split them apart, and that gives you energy, but the parts that are left over are radioactive, and that's a waste problem. Fusion is the opposite. You fuse things together, and when you fuse them together...
And, like, here's the thing. I actually think that nuclear fusion and I believe fusion and the current nuclear stuff we have right now could actually be beneficial. Like, I think that this could potentially, like, I'm not a scientist in any means. I'm just going off of speculation and what I believe potentially could happen. I do think that we could possibly get or I do think that this could potentially solve the nuclear waste problem that we see, right? Like don't take my word for it, but it could potentially easily solve that problem, right? Or am I just being a dumbass himbo? But yeah, no, this is incredibly exciting.
There's a little piece that's left over here that flies off, and that gives you the energy that you're looking for, and what's left is not radioactive. It's helium. It doesn't heat up the atmosphere. Fill your party balloons with it. So that's the idea. Now, what they did with this experiment was that they hit a little tiny target that's the size of that, and I'm not kidding. They fired 192 lasers at this thing, and they heated it up to 100 million degrees, and for a fraction of a second, it went pop. And what came out of that pop had more energy than the lasers that went into it. That's why everybody's exciting. But in the future, we're going to need a new design to make electricity.
So this is
I mean, right now, as things stand, yeah, it's completely it's completely ineffective. But the fact that we are able to do so is incredibly exciting. Like, yeah, we can invent new ways of doing fusion for sure. And I imagine that people are going to be looking at that for sure. But no, this is incredibly exciting, man. Like we should 100% be focused or being focused on this.
Well, obviously it's been decades, could be a while, but what do we need to watch for next, briefly?
There are a couple of projects under construction right now. One's called ITER, the other one is called Spark, and they make a donut, a plasma of super hot 150 million degrees gas that burns continuously. And they're expecting to get 10 times the energy out that they put into it, so it will be self-sufficient. They're expecting to get the first plasmas around 2025, and we should see some commercial reactors in the early
2025? That's not even too far off. That's a lot closer than I thought it was going to be. That's very exciting, man.
2030s. That's the timeline.
2030, let's go.
Thank you.
Okay, Adrian.
It sounds too good to be true. Energy that is neither polluting nor radioactive. Nuclear fusion, the same energy that powers the sun and stars. Fusing atoms has been an elusive force, an unsustainable energy for scientists to replicate on Earth. Too much energy goes in for what comes out. Now, scientists at the Lawrence Livermore Laboratory in California have made a breakthrough that they will announce Tuesday. Similar work is underway at General Fusion in Vancouver, where they're pioneering plasmas to create a net energy gain.
Fusion is the holy grail of energy. The industry's been chasing this for a long time, achieving those conditions in a way that you get more energy out than what you put in. Is a big important step.
For about 75 years, the world has harnessed nuclear power using fission, energy that comes from splitting atoms. In fusion, atoms are joined, creating bigger atoms, also releasing energy. What difference does that make? Well, in fission, heavier atoms are needed, primarily uranium as well as plutonium, which are radioactive, and you're left with used nuclear fuel that remains contaminated for tens of thousands of years. In fusion, lighter atoms such as hydrogen can be smashed together, and what's produced are larger helium atoms, creating even more powerful energy with little or no.
And that's another thing that we haven't discussed about with fusion, is that we won't necessarily have to put people in harm's way when it comes to like radioactive materials as well. So we won't have to worry about like the incidents at like Chernobyl or in Japan or that happened. Like it's going to be very hard for oil companies and people who defend big oil to combat this, because with fission it's, oh well, you create a bunch of radioactive waste and you know you don't have an efficient way of disposing it. But with fusion, that kind of falls apart, right?
Radioactive waste. Nuclear fission energy is a legacy that Canada in particular must deal with. Ontario's Bruce nuclear plant stores more than 1 million spent radioactive bundles in huge containers, for which a permanent disposal site must still be found. The race for clean fusion power is on in labs all over the world. With its partner in the UK, General Fusion plans to build a demonstration power plant that will be up and running in about 4 years, with a full-scale
That's
commercial
very
plant
exciting.
on the grid in the early 2030s.
You're creating a mini sun on the Earth. And so when you're doing that inside a machine, you can imagine the damage that happens to it. You can imagine the challenges with extracting that energy and actually converting it to something useful and putting it on the grid.
At one time, fusion seemed an unattainable, maybe even unnecessary pipe dream. But in the era of climate change, there is increasing awareness that clean energy solutions for future generations have to be developed now. Fusion could be a big part of that cleaner, safer future. Eric Sorensen, Global News, Toronto.
I mean, it's just very exciting though, right? Neil deGrasse Tyson? Discuss that?
The U.S. Department of Energy is expected to announce a milestone in nuclear fusion technology. Scientists say it could be revolutionary as the world looks for a cheap, renewable alternative to fossil fuels. We'll bring you that announcement live as soon as it gets underway right here on
I actually never
Network.
got a chance to see
For
this.
now, I want to bring in Bob McDonald. He's the host of CBC's Quirks and Quarks. He's
Hey,
also the author of The Future Is Now.
I don't care.
Put into it.
I want to see the discussion.
Explainer we needed. And just as you were doing that, we know here that the U.S. Department of Energy spokesperson has come up right now, and we're going to take you to that announcement.
And that is creating more energy from fusion reactions than the energy used to start the process. It's the first time it has ever been done in a laboratory, anywhere in the world. Simply put, this is one of the most impressive scientific feats of the 21st century. Or, as the president might say, right? I do think he probably did say this is a BFD. Researchers at Livermore and around the world have been working on this moment for more than 60 years. So, what does this accomplishment do? Two things. First, it strengthens our national security because it opens a new realm for maintaining a safe, secure, and effective nuclear deterrent in an age where we do not have nuclear testing. Ignition allows us to replicate, for the first time, certain conditions that are found only in the stars and the sun. And the second thing it does, of course, is that this milestone moves us one significant step closer to the possibility of zero carbon, abundant fusion energy powering our society. If we can advance fusion energy, we could use it to produce clean electricity, transportation fuels, power heavy industry, so much more. It would be like adding a power drill to our toolbox in building this clean energy economy. So today, we tell the world that America has achieved a tremendous scientific breakthrough, one that happened because we invested in our national labs and we invested in fundamental research. And tomorrow, we'll continue to work toward a future that is powered in part by fusion energy. Fortunately, private sector investment in fusion research is already booming. It has reached nearly $3 billion in last year alone, and we've heard from professors that interest among students
I imagine it's only going to be going up, right?
which is terrific.
Like, it has to only be going up, right?
Administration is aiming to capitalize on this moment.
This is incredibly exciting.
Announcement is a huge step forward to the president's goal of achieving commercial fusion within a decade. But there's still a lot more to do, so much more. We'll continue to work toward that goal and find other ways to progress to reach fusion energy. So, for example, in September, the Department of Energy made a $50 million investment for public-private partnerships to start working toward fusion pilot plant designs. And we're partnering with the Office of Science and Technology Policy to map out the president's bold vision for driving that commercial fusion in the next decade with the highest safety standards, with cost-effective, equitable deployment that positions American businesses to lead and communities to thrive, and with a skilled workforce that's diverse and inclusive. This is what it looks like for America to lead, and we're just getting started. Another big congratulations to Lawrence Livermore National Lab. Their team is here. Where are you, team? There you are. And they'll be, yes. They'll they'll be joining us after this for a technical panel for those of you who wish to stay to learn more. Big applause and thank you to the NNSA, the National Nuclear Security Administration. And everybody who has been involved in this fusion breakthrough that will go down in the history books. You're going to hear more about the details of the experiment from Administrator Ruby and Director Budil. But first, I'm going to turn it over to the President's Science Advisor and Director of the OSTP, Dr. Arati Prabhakar.
Thank you so much. Thanks, Secretary Granholm. What a pleasure to be invited to come celebrate this amazing moment here at the Department of Energy. It's really a privilege to be here. So when I heard this news, for me, the years fell away, and all of a sudden it was 1978. I was a summer student in the middle of my college years, 19-year-old kid, and I got the chance to go work at Lawrence Livermore National Laboratory. And I showed up. And so you got to picture this. I'm wearing my bell bottoms. I've got long black hair. And I show up, and I'm a 19-year-old kid, and they give me a laser to work on. And I said, this is cool. I like lasers. But what's this laser all about? And they said, we think that if you point enough lasers at a pellet of fuel, we want to see if we can get more energy released from fusion than the amount of energy that the lasers deliver into that pellet. And I said, well, that's cool. And I spent 3 months working on this fun laser. And, and after my adventure with the laser that summer in Livermore ended, I went off and did completely unrelated things. But I have always kept an eye out and watched to see what was happening at Livermore as they pursued this idea of ignition, of achieving this kind of controlled fusion reaction for decades. And I went off and didn't do anything more about fusion, but the people I worked with and their successors kept going. And they went through periods of triumph, and they went through tremendous struggles and setbacks. They never lost sight of this goal. And last week, lo and behold, indeed, they shot a bunch of lasers at a pellet of fuel, and more energy was released from that fusion ignition than the energy of the lasers going in. And I just think this is such a tremendous example of what perseverance really can achieve. And I had the great pleasure of meeting the team, whom you'll talk with when you hear the panel in a little while. And they have come from many different parts of the world. They've studied many different fields. Many of them were summer students at Livermore, but decades after I was. So it took not just one generation, but generations of people pursuing this goal. And it's a scientific milestone, scientific energy break even to achieve this. But of course, as with all of these kinds of complex scientific undertakings, it's also an engineering marvel beyond belief. And this duality of advancing the research, building the complex engineering systems, both sides learning from each other, this is how we do really big, hard things. So this is just a beautiful example. So, I also have been reflecting on how long the journey can be from knowing to doing, because it's a century since we figured out that it was fusion that was going on in our sun and all the other stars. And in that century, it took so many different kinds of advances that ultimately came together to the point that we could replicate that fusion activity in this controllable way in a laboratory. And I think it's just a reminder that sometimes, even when we know something, it's a very long time before we can turn it into something that we can actually harness and start to be able to use. And as the Secretary described, I think it's that prospect now is one step closer in a really exciting way. Okay, so, let me just finish by saying I think this is an amazing example of the power of America's research and development enterprise. This is what the Department of Energy works every day to support and to drive. It's what our Office of Science and Technology Policy at the White House focuses on every day, is how do we strengthen and advance this enterprise. And it is an enterprise that President Biden has championed in a way that no one really ever has before. He's submitted a budget for supporting federal R&D that is the biggest ever that we've had in this country. And so I want to take a moment and congratulate the entire Department of Energy with Secretary Granholm's tremendous leadership, the National Nuclear Security Administration here that has championed this effort for so long, Lawrence Livermore National Laboratory, and especially and particularly all the scientists and engineers across many years who got us to this moment. President Biden loves to say that the one word that defines America is possibilities, and this is such a wonderful example of a possibility realized, a scientific milestone achieved, and a road ahead to the possibilities for clean energy and even deeper understanding of the scientific principles that are at play here. So thanks again, congratulations, and all the best from the White House. And now, thank you. Thanks so much. And now it's my privilege to get to introduce Jill Ruby. She is the Undersecretary for Nuclear Security here at the Department of Energy and also the Administrator of NNSA.
So we were listening to the U.S. Energy Secretary and the Science Advisor to the President as they were speaking about a major breakthrough in harnessing fusion energy. Now, this is
No, why'd you cut from it?
milestone in a decades-long attempt to source.
I don't care about this, bro. Whatever, we'll move on. Scientists announced Tuesday that they have, for the first time, produced more energy in a fusion reaction than was used to ignite it. A major breakthrough in the decades-long quest to harness the process that powers the sun. Researchers at the Lawrence Livermore National Laboratory in California achieved the result, which is called net energy gain, the U.S. Energy Department said. Net energy gain has been an exclusive goal because of fusion happens at such high temperatures and pressures that it is incredibly difficult to control. The breakthrough will pave the way for advancements in national defense and the future of clean energy. Energy Secretary Jennifer Granholm and others and other officials said. Ignition allows us to replicate for the first time certain conditions that are found only in stars and the sun. Granholm told a news conference in Washington, D.C. This milestone moves us one significant step closer to the possibility of net zero zero carbon advanced fusion energy powering our society. Fusion ignition is one of the most impressive scientific feats in the 21st century, Granholm said, adding, the breakthrough will go down in the history books. This absolutely will go down in the history books. This is a gigantic breakthrough. Like I said earlier, it's like humans discovering fire or being able or like using the wheel. Like those things seem trivial now, right? But this is essentially the modern day equivalence to that at the time, right? Appearing with Granholm, the White House scientist advisor, Arit Pabakar, right? I hope I'm saying that right. Called the fusion ignition a tremendous example of what perseverance really can achieve, and an engineering marvel beyond belief. Proponents of fusion hope that it could one day offer nearly limitless carbon-free energy and displace fossil fuels and other traditional energy sources, producing energy that powers homes and businesses from fusion is still decades away, but researchers said the announcement marked a significant advance unless. I do agree. It's almost like it's a strange gun going off, said Professor Denise White, director of the Plasma Science and Fusion Center at the Massachusetts Institute of Technology and a leader in fusion research. Man, I cannot say Massachusetts. We should be pushing towards making fusion energy systems available to tackle climate change and energy security. Kim Buddle, director of the Lawrence Livermore Lab, said there are very significant hurdles to commercial use for fusion technology, but advances in recent years means the technology is likely to be widely used in a few decades rather than 50 or 60 years as previously expected. Fusion works by pressing hydrogen atoms into other surface into each other, with such a force that they can combine into helium, releasing enormous amounts of energy and heat. Unlike other nuclear reactions, it doesn't create radioactive waste. U.S. President Joe Biden called the breakthrough a good example of the need to continue to invest in research and development. Look what's going on from the Department of Energy on the nuclear front. There's a lot of good news on the horizon, he said at the White House. I could just imagine him saying that, man. Like half asleep and everything. That would be really funny. Billions of dollars and decades of work have gone into fusion research that has produced exhilarating results for fractions of a second. Previously, researchers at the National Ignition Facility have the division of Lawrence Livermore, where the success took place, used 192 lasers and temperatures multiple times hotter than the center of the sun to create an extremely brief fusion reaction. The lasers focus an enormous amount of heat on a small metal can. The result is a superheated plasma environment from where fusion may occur. Ricardo Betti, a professor at the University of Rochester and expert in laser fusion, said there's a long road ahead before the net energy gain leads to sustainable electricity. He likened the breakthrough to when humans first learned that refining oil into gasoline and igniting it could produce an explosion. You still don't have the engine, you still don't have the tires, Bennett said. You can't say that you have the car. I mean, it still doesn't matter too much because this is very exciting news. The net energy gain achievement applied to the fusion reaction itself, not the total amount of power it took to operate the lasers and run the project, For fusion to be viable, it will need to produce significantly more power and for longer. It is incredibly difficult to control the physics of stars. White, of the Plasma Science and Fusion Center, said the field has to be hotter than the center of the sun. The field does not want to stay hot. It wants to leak out and get cold. Containing it is a challenge, he said. The achievement of net energy gain isn't a huge surprise from the California lab because of the progress it had already made, according to Jeremy Tretton, a professor at Imperial College London who specializes in plasma physics. We have a diagram from like grade 5 on like how fusion works. Hell yeah. But he said that doesn't take away from the fact that this is a significant milestone. One approach to fusion turns hydrogen into plasma and electrically charged gas, which is then controlled by enormous magnets. This method is being explored in France in a collaboration among 35 countries called the International Thermonuclear Experimental Reactor, as well as by researchers at the Massachusetts Institute of Technology and a private company. Private company aspect of it definitely does have me concerned, because, you know, if you're going to be buying something that, or a product that doesn't necessarily need a shit ton of accessories, and it has like better batteries and everything, that does definitely raise some concerns for sure. Last year the teams working on those projects on two continents announced significant advancements in the vital magnets needed for their work. This is the deuterium tritium fusion reaction. So you take the deuterium, which is a neutron and a proton, the tritium is 2 neutrons and a proton, and you fuse them together, and you get high energy neutrons, and helium or alpha particles. I mean, that's pretty basic stuff. Very, very exciting though, for sure.
Our deepest.
Okay, let's move on to Jim Carr's death. Jim Carr was a liberal I think he was a liberal MP that had passed away on the 12th, I believe. Yeah, let's take a look and see what.
Condolences to the constituents of Winnipeg South Centre, of course, to Mr. Carr's family and friends on his passing. He was only in here last week passing his bill, so it just shows how quickly things can change in our lives, and then we lose friends and family in that way.
Carr was diagnosed with blood cancer and kidney failure during the 2019 federal election campaign. He died at home with his family around him at the age of 71. Carr served in the Manitoba legislature between 1988 and 1992. He became an MP in 2015 and served in several portfolios, including as Natural Resources Minister, International Trade Diversification Minister, and Special Representative for the Prairies. As a mark of respect, the House of Commons has adjourned until tomorrow morning.
So one interesting thing about Carr is he initially started off with trying to run as conservative. So keep that in mind.
Let's bring in the CBC's Karina Roman live in Ottawa. And Karina, tell us about Jim Carr. I mean, really, it's incredible just to see the outpouring of support and just kind words from so many.
Absolutely, and you're getting glimpses as well as to his personality and who he was as a person, not just as a politician. He was a husband, a father, a grandfather. He used to play the oboe with the Winnipeg.
You have people claiming that simply touching and being near fentanyl can't cause you to overdose. Oh, that is so funny. No, that doesn't happen. Wasn't it like discovered that the cops that were claiming to like have overdosed from fentanyl were just like having panic attacks? That is so funny, man. Where's this from? Fox News? Of course it's from Fox News, bro. That is so funny.
Symphony, which shows just, you know, how diverse and multifaceted people can be. As you mentioned, Andrew, he entered federal politics in 2015, quickly became a cabinet minister. As you said, he held the natural resources position. He also was the Minister for International Trade and Diversification. It was during the 2019 election campaign that he was diagnosed with blood cancer, but he went ahead and ran anyway and won and decided to serve. Now, he did step away from cabinet, fully understandable, because he had to undergo treatment. But because the Liberals didn't fare so well in the prairies during that election, Justin Trudeau asked him
Never mind. I was wrong. He lost to the conservative, or the progressive conservatives leader, Jerry Fulman. Never mind, I was wrong. I thought he initially tried to run for the conservative, it's my bad.
The special representative for the prairies, and he said yes to that. Now, during his illness, he went through chemotherapy. He had to have dialysis for his kidney failure. He did have a stem cell transplant, but that was much delayed because of the pandemic, but he did go through that as well. And so all through that, all that treatment, he still worked as an MP. He still either showed up virtually when it was during the pandemic, or more recently, he still came to the House of Commons every day and, you know, showed up for work. And people say that that's a testament to how committed he was to his job and to his constituents. Last week, his private member's bill, which was building a green prairie economy, passed third reading.
I mean, to be perfectly honest, I don't really know too much about Jim Carr. I'm mostly like indifferent to his passing, but I mean, yeah, that's just my view on it. I'm mostly just indifferent.
A huge accomplishment, a big feat, especially since it turns out he was clearly more ill than some people thought or understood. And yet, you know, as his family says, he worked right until the end and showed what he could accomplish right until the end.
Yeah, I think it was just a little bit shocking because, of course, people knew that he had been sick, but we saw him on Power and Politics. He was passing that bill. So we could hear that gasp in the House of Commons when it was announced. Tell us more about the reaction.
Oh wait, wasn't he the guy that we had discussed like last week? Or the week before? I actually kind of vaguely remembered talking about something he was trying to pass. I don't quite remember. That was a while ago.
Yes, there were some people who, when they were coming, because obviously not everyone understood that, the House of Commons was suspended, which also means the committees are suspended and all other work is suspended for the day on the Hill. And so some MPs, that were coming in, for question period didn't know yet. And so the shock as well outside the Commons was quite palpable as well. He's being described, as a class act, a bridge builder. There's a reason why such sadness and sorrow and heartfelt sadness and sorrow is being expressed by all parties because he really was well-liked and respected on all sides of the aisle. Have a listen to some of the reaction.
He got sick right after the last election. I too was in hospital recovering from a different kind of blood cancer. And Jim and I have spoken a lot in the last weeks and months about the kind of treatments he was going through, not dissimilar to the ones that I went through. So we had that sad bond of both having had a form of blood cancer, and that's why it makes it, I think, very difficult for so many of us.
Yeah, I had the honor of sitting beside Jim. He was a wonderful human being, and I used to say to him every day, "How are you feeling, Jim?" And he said, "Every day counts." And most of us would love to be able to go out the way he did to the end, doing what he loved. It was an honor to be with him.
All of us are shocked, saddened, and heartbroken. I've known Jim since he was an MLA in Manitoba and president of Manitoba Business Council. Somebody that, despite our partisan differences, I've always considered a friend. He's a great champion for Manitoba, and I know that his family is very heartbroken right now. I'll offer my sympathy and condolences.
Now, we are still waiting for a statement from the Prime Minister, and that is expected at some point soon. We have seen an outpouring, whether it's on Twitter or social media or just in statements through press releases, from business leaders, from Indigenous groups, international figures. The former U.S. Ambassador to Canada, Bruce Heyman, also putting out a statement of condolences, how much he enjoyed working with Mr. Carr. So, really such a wide range of responses from beyond the political sphere.
Karina, thank you. The CBC's Karina Roman live in Ottawa. Foreign Affairs Minister Mélanie Joly spoke to reporters about Jim Carr in the foyer of the House of Commons. She reflected on the friendship that grew from their very first meeting.
The first time I met Jim was in 2015. It was our first cabinet swearing in. We bumped into each other. We were actually sitting side by side on the bus heading to Rideau Hall. And it clicked. We got along very well. His son would later work for me as my Director of Parliamentary Affairs, Ben. And politics runs in the family. Jim was a bridge builder. He was a man that believed in the positive change that politics can bring. He was always very proud of Winnipeg. He was a hobo player, had played in the Winnipeg Symphonic Orchestra. He was also not only a patron for the arts, but a strong supporter of the business community in Winnipeg. And, I think Canadians will remember him as being a strong voice for the prairies and a strong voice for positive change. And so to his family and loved ones, thank you for sharing Dad and sharing your friend with us here in Ottawa and with the country. And I think Canada is a better place because Jim Carr worked every day to make it a better place.
Liberal MP and Minister of Tourism Randy Boissonnault also shared his condolences today, calling Carr a mentor.
Today's a great loss for Canada, for Manitoba, for the Prairie West,
for Jim's family. He's a mentor, and I said to my team, he's like my parliamentary dad. Ben and I were colleagues in Heritage, and it's fitting to pause and to remember the life of a businessman, a great Canadian patriot, an oboist, a humanitarian, and that deep, gravelly voice that was on radio with Peter Zofsky when I was a kid. And I got to serve in Parliament with a great Canadian, a great friend and a great mentor. Et nous allons se souvenir longtemps du travail de Jim Carr. Thankfully, he got his motion passed. And I think we can all hear the voice that he might have shared with us this Thursday in the House. And my deep condolences to the Carr family and to everybody who's been touched by the love and respect of the Honourable Jim Carr.
And the CBC's Cam McIntosh is in Winnipeg, Jim Carr's home city. He joins us now with early reaction. And so, Cam, we're hearing from Jim Carr's family. What are they saying?
Yes, Jim Carr's family released a statement just this afternoon, and I'll read a bit of it for you here, Andrew. Right up until the very end of his remarkable life, he was fighting for Winnipeggers, Manitobans, and Canadians. He was extremely pleased to have his private member's bill C-235, building a green prairie economy, pass through the House of Commons on December 8th. Working with his fellow members.
Oh yeah, that's what it was.
On this important
I couldn't remember what legislation he was trying to push. I mean, it's not terrible. I'll give him that.
Community leader in Manitoba over the last 30 years. Jim was loved and respected by so many, and we know he will be profoundly missed. And we are starting to hear from other leaders here in Manitoba. From the Premier of Manitoba, Heather Stephenson. It's with a heavy heart that I offer my deepest sympathies and condolences to the family and friends of Jim Carr. Over the years, Jim and I worked on many projects together. I always admire his unfailing commitment to the betterment of Winnipeg, Manitoba, and Canada. Thank you, Jim. And from Winnipeg's newly elected Mayor, Scott Gillingham, Jim was a giant in our community, and his work as a musician, journalist, arts and business advocate, and provincial, federal elected official strengthened our city and touched the lives of many Manitobans. He will be missed. And we're starting to see more and more of this type of tribute coming in right now for Jim Carr. We also have a camera over in his constituency, which is not too far from here, and the news is hitting some people over there pretty hard. Jim Carr was a respected business leader in the community. He was a respected politician. Winnipeg South Centre was his constituency. Now that has been a long time Liberal seat here in Winnipeg. You may recall Lloyd Axworthy held that seat through the end of the 70s, the 80s, and the 90s. Jim Carr flipped that seat back to the Liberals in 2015 and had held on to it ever since, winning with slightly bigger and bigger outcomes each time he ran. So respected in his riding, respected in the community here, and certainly respected by politicians and business leaders of all political stripes.
And right across the country. And he said that he loved every square meter of Canada, every square meter of this country. But can you walk us through his contribution to the people of Winnipeg and indeed Manitoba?
So Jim Carr isn't the type of politician where you point to a building in downtown Winnipeg or somewhere else and say, hey, Jim Carr did that. That was a Jim Carr project. What Jim Carr did was really work in the background. The Business Council of Manitoba is a good example of that. That was founded in the late 90s, and it's really a nonpartisan advocacy group that gets basically politicians and business together to work for the betterment of the community. And that was the kind of work Jim Carr really liked to do. The way it's been, you can really describe him as...
Business in Winnipeg is pretty shit, though. Not gonna lie.
A Liberal that, was part of the social tradition of the Liberal Party, but was also very business-minded. He was a guy who was just as comfortable walking down Bay Street, Toronto, as he was walking down Portage Avenue here in Winnipeg. So really trying to bring about ways that the business community could really help in the social fabric of a community like Winnipeg and out here on the prairies. And of course, that kind of work became really important for the prairies after 2019, when basically the Liberals were all but wiped out, right? So we have Jim Carr and a few Liberal seats here in Winnipeg, but Ralph Goodale, who...
I mean, like, historically, though, when it comes down to, like, provincial elections, the Liberals hold, like, no fucking candle. It's usually either NDP or Conservative. I imagine that the NDP will probably win their next election against Heather Stephenson. But I guess time will tell for sure.
Been this champion for the prairies for a very long time in Ottawa, both in government and in opposition. He was gone. Jim Carr really kind of picked up that mantle. At the time in 2019, he was learning that he was sick. In fact, I was there election night at his constituency party, covering things off there, and we had learned just after that that Jim Carr had gotten this diagnosis, and it was a bittersweet night for him. He acknowledged to us later, but at that time, he left the federal cabinet and basically took on a new role as basically special representative for the prairies for the prime minister. And he really relished that role, being that point person for Alberta, Saskatchewan, and Manitoba, which by then had all elected conservative governments, someone that they could talk to basically get a voice in with the federal cabinet or with the prime minister's office. And that's not to say by any stretch that people always saw eye to eye or continue to, but Jim Carr was certainly a respected figure, whether it was here in Manitoba, whether it was in Saskatchewan, or dealing with, say, the oil interests.
I love hearing conservatives say that, but yet literally when it came to like any fucking issue, they were not really too fucking impressed with him. Like, yeah, okay, you're just paying lip service because he fucking died.
Or the provincial government of Alberta as well.
Cam, thank you. The CBC's Cam McIntosh live in Winnipeg.
And Glenn McGregor, our senior political correspondent. Glenn, I mean, Jim Carr, cabinet minister, natural resources minister, always seemed like a nice guy.
Somebody who was super well regarded by his colleagues in the House of Commons. I know that's almost a cliche that we often hear that after a member of Parliament dies. In this case, it was genuinely true. He was extremely well liked. Gentleman Jim, some people called him. He was just a very kind, quiet manner, but also an effective politician in his time. He served at the federal level as Minister of Natural Resources, a really key portfolio.
Like the last person I can remember who had like a huge impact after their passing was Jack Layton, but like understandably Jack Layton was liked by a vast majority of Canadians, like even more than Singh is currently. Like I think that was a more important death to Canadian politics than Jim Carr, to be perfectly honest.
And also international trade before he started to show real signs of serious illness. And then in
like Jim Carr lived or had a good life. He lived till fucking 71.
Saskatchewan, you remember Ralph Goodale was their sole member from Saskatchewan. They had no MPs on the prairies other than Jim Carr and Kevin Lamoureux, I believe was the other one from Manitoba. So he kind of took on the role as the prairies envoy in cabinet, even though he was, I think at that time, was beginning to become sick. So a big loss for the House of Commons, not so much the government. It's just going to be a lot of people really liked Jim Carr and had a lot of respect for him, and it's going to be obviously at a young age that he died, 71, particularly sad this soon before the holidays.
Yeah, and I think you raised some great points. I mean, very classy and a gentleman. And also, that was a tricky portfolio, natural resources, especially at the time, the Trudeau government coming in.
Is it really, though?
There was a lot of anger, particularly in Alberta and Saskatchewan, at Jim Carr and also at the government over different initiatives that were brought forth. And, he tried to always handle that.
See, what did I say? Whenever it came to like literally anything he fucking did, the Conservatives would fucking have their reactionary little temper tantrum. But now they're only fucking paying lip service. It's like, oh, he was such a good guy, blah blah blah.
Portfolio, listening, being understanding, but still, of course, supporting the Trudeau government's vision.
Yeah, you remember the Trudeau government early in its mandate after the 2015 election went to Paris and signed on to the Paris Accord and made it clear their intention to impose carbon pricing across the country on provinces that didn't want to play along, that didn't have carbon pricing already in place. Crucially, that meant Saskatchewan and also later Alberta. So he had to be kind of the front man for that. And for somebody from Western Canada, that's not a popular position to be in when so much of the economy from that region is dependent on the oil and gas sector. So he was immediately thrust into
I mean, another sector that's relatively big out there is farming as well. Vast majority of that stuff comes from prairie provinces. There's that.
a role of conflict in that job.
It's not their only industry out there.
On the carbon backstop that was eventually put in place. So but I mean, to his credit though, was still very well regarded by them, and also by Conservative opposition in the House of Commons, who would have been grilling him on this on a regular basis in question period because of their opposition to carbon pricing being imposed by the federal government. So he leaves obviously a very impressive legacy here as an MP. Also, now his death obviously means that there's going to be by-election at some point. We're already seeing a by-election tonight in another riding to replace a Liberal MP who has resigned, but that'll be something that will be much further down the road, Tom.
Yeah, I thought it was also interesting. We're just going to bring up a statement too that has been issued by Jim Carr's family, and just reading in part, Glenn, I know you've had a chance to look at this too, that he had been battling multiple myeloma and kidney failure since 2019. He was getting dialysis, chemotherapy, bone marrow transplant as well, and he continued, of course, to represent the riding in Winnipeg as he had done prior to that. And what's interesting too about Jim Carr is, first of all, he was a provincial politician, Glenn, as you know, in Manitoba, and then he took time out of politics, for a good about almost 22
What?
23 years, give or take, from the early 90s right through to the mid 2015, 14, when he announced he would get back into politics, this time on a federal level.
Right. Yeah, and he was really instrumental in leading the Liberal campaign effort in Manitoba. That is a province, unlike Saskatchewan and Alberta, where the Liberals are competitive in many seats, especially in and around Winnipeg. So he was key. And I remember seeing him on the last election campaign in 2021. I was on the Prime Minister's, or the Liberal leaders tour, as we called it then, when it made a stop in Winnipeg. And there was an outdoor barbecue event one evening, and Mr. Carr came out, and he was obviously very sick. He looked did not look well, but he was jovial, and he knew everybody there, and he was kind of going around saying hi to everybody, and he knew all the journalists too. And he came up to us, and I think he recognized that people who were seeing him, who hadn't seen him in a while, were going to be taken aback by his appearance because of the effects of his illness, and probably also from the treatment. But he was in really good spirits, and he was enjoying himself at this campaign event in downtown Winnipeg, and that's how I remember him.
Yeah, and the other last thing, Glenn, is somewhat think of a centrist. I think had a lot of ties to the business community.
Yeah, it was really fucking annoying too.
Challenges that Manitoba was facing, and the idea of trying to cut costs. So this guy was not sort of a lefty, as some critics would call the Trudeau government.
Bro, literally every single fucking hog thinks that like any Liberal is a fucking leftist, and it's so fucking annoying. It's like, yeah, sure, okay, totally. I totally fucking vote for the Liberals. So fucking annoying. Like, he is slightly better than the fucking hogs that come out of Manitoba, but it's not saying much though, because Manitoba sends some very fucking interesting hogs to the parliament.
I mean, he really prided himself on being a centrist.
He did, and he
and like centrists are just essentially fucking right wingers. Like that's all that they are essentially.
That background made him well suited to the portfolios that Justin Trudeau asked him to fill, both in international trade, of course, a very business-facing portfolio, and also in natural resources. And I mean that's kind of the loss for politically for the Trudeau government, is losing somebody who had that stature and respect in the business community, but was also so integrated into Manitoba politics. He will be somebody he will be difficult to replace in that role.
Glenn McGregor in Ottawa, Jim Carr passing away at the age of 71. Thank you for this, Glenn.
I mean, maybe in Ottawa, but that doesn't necessarily mean anything.
I don't know how appropriate this is, but I would ask my colleagues if you, Mr. Speaker, could just give a moment of silence. Our colleague Jim Carr just passed away, and I think it would be an appropriate thing if we could just have a moment of silence and a prayer.
Larry, we'll stand for a moment of silence for the passing of the honourable member, Jim Carr.
Damn, bro, is it like fucking 2 minutes of this?
I thought maybe it'd be good to just pass on, of course, if people want to speak quickly to this, I think maybe we'll allow that for a few moments, but just to pass on our deepest condolences to the constituents of Winnipeg South Centre, of course, to Mr. Carr's family and friends on his passing. He was only in here last week passing his bill, so it just shows how quickly things can change in our lives, and then we lose friends and family in that way. So I know maybe the honourable member for Winnipeg North, anything quickly to add before we move on to our next. You were the closest.
Yes, well, thank you, Mr. Speaker. I realize it's a very sensitive time, and there's no doubt other members that would like to be able to contribute at a more appropriate time in giving our condolences to the family and friends. We all know Jim's passion for his country. We saw that in just a speech he delivered last week.
The Honourable Government House Leader is rising.
Thank you, Mr. Speaker. It's a very sad day for our parliamentary family. As has been announced to the House, our dear friend and colleague, the Honourable Jim Carr, has died. And Mr. Speaker, given that news, I move that the House do adjourn.
By unanimous consent, the House adjourns out of respect for the late Honourable Jim Carr, MP for Winnipeg South Centre.
I do think that Jim Carr was like one of the less shit liberals, to be honest, but that's not saying much. The fucking liberals are just awful. They don't do anything, man. Manitoba MP and former Liberal cabinet minister Jim Carr is being remembered for his humor and dedication to Canada following his death after the battle with cancer. The news was announced in the House of Commons Monday. Carr was 71. Carr, who had represented Winnipeg South Centre since 2015, was diagnosed with multiple myeloma, a type of blood cancer, the day after he was re-elected on October 21st, 2019. He also battled kidney failure. I mean, when he's like that fucking old, I'm not surprised that he was dealing with like multiple different things. In one of his final interviews, Carr told CBC's Power and Politics last week that while his health was failing, he was still grateful for another opportunity to contribute to the country he loves so much. Physically not great, but emotionally really, really solid, and grateful for the chance to continue and contribute to my country, he said with a smile. I love every square meter of this country in English, en français, in indigenous languages. I wish I spoke more of them in the language of the newly arrived and all that represented to Canada and Canadians. I mean, honestly, that's just fucking posturing. It's typical liberal shit. Not really surprised that he would have said that. In a statement, his family said he was pleased to see his bill building a green prairie economy passed through the House of Commons just last week. Working with his fellow members of parliament across the country over the past few months on this important legislation filled him with energy and kept his spirits high, his family wrote. As a dedicated elected official, business, and community leader in Manitoba for over 30 years, Jim was loved and respected by so many, and we know he will be profoundly missed. I'm not really too sure about that. Most Manitobans are indifferent. His passing brought on a wave of condolences messages from across the country from his colleagues from both sides of the aisle. Prime Minister Justin Trudeau said the country has lost a dedicated parliamentarian. Jim Carr's passion, tendency, integrity, humor, and commitment to the prairies were second to none, and we'll miss him dearly, he tweeted. I always admire his unfailing commitment to the betterment of Winnipeg, Manitoba, and Canada, tweeted Manitoba Premier Heather Stephenson. I mean, that's just a load of bullshit, because Winnipeg is fucking awful. Let's be completely real with ourselves. Like, it's incredibly fucking poor. There's a bunch of fucking crime because of that poverty, and there's so fucking many problems, other problems that are a part of that. Like, it's paying tribute on Twitter. Former Conservative leader Aaron O'Toole called Carr honorable and very well respected on all sides. Yeah, shut up, fuck. NDP MP Charles Agnes called him a class act. We sat near each other in the house. Every day I asked him, "How are you doing, Jim?" Every day counts, he would say with a big smile. Angus tweeted, "He served Canada with honor." Carr served in 2 high-profile roles before taking a step back following his diagnosis. He first sat at the cabinet table as Natural Resource Minister and helped to oversee the government's $4.5 billion purchase of the Trans Mountain Pipeline, which led to literally nothing. That was a really great purchase by the fucking government. Carr was then given the international trade portfolio in the summer of 2018 as a NAFTA regulations raged on. He was given the task of diversifying Canada's trade partnerships beyond the United States. Julian Ovens, who served as Jim Carr's chief of staff when he was trade minister, said groups like the Ottawa Team Working and World Trade Organization reform only worked because of his chairmanship. I'm not convinced by that. Literally, almost any fucking Liberal MP would have sufficed for that. I don't really think Carr would have, Carr not being in that position would have changed anything. He was a gentleman, a moderate, a great colleague, and absolutely the best chair of any organization or meeting one you could ask for, he said. He was an important member of the Jewish community in Winnipeg. He was always interested in how he could advance peace. Manitoba and the prairies were always close to his heart in Ottawa. Carr worked as a professional hobbyist and journalist before the snit of provincial politics. He then became president and CEO of the Business Council of Manitoba and was awarded the Order of Manitoba. Liberal MP Mark Arnoux a former astronaut, tweeted what he called his best memory of Carr. Uh, he asked me if I took music into space, and I mentioned Marcello's oboe concerto. He then told me he played the oboe, and we cooked up the idea for him to play the second movement at Liberal National Caucus, wrote Conroe. He was excellent. Sweet moment. And a public memorial will be held for Carr on Saturday at the council or at the Central Concert Hall in Winnipeg. Not gonna be going to that shit. All right, let's move on to the hangings that were in Iran, which is not a good look for Iran.
Video of Majid Reza Ranavard alive before his execution. The 23-year-old in an Iranian court appearing to justify his hatred of Iran's Basij volunteer paramilitary force. Authorities convicted him of killing 2 Basij members based on this grainy CCTV footage and a recorded statement after his arrest where he neither confessed to nor denied the attack. His execution was just 3 weeks after the incident and just 4 days after Mohsen Shikari was also hanged for assaulting another Basij member.
I mean, with the reactionary government that's currently in place in Iran, it's not surprising that this would happen at all. Like, it was more or less a matter of time before they would start like executing people. Like, that's just what happens with a fucking reactionary government. It's more of a matter. It's not a matter of if. It's more of a matter of when. Like, I wouldn't be surprised if some other other reactionary countries are doing so as well.
These executions have taken place following sham politically motivated trial, with the authorities violating the most basic standards of fair trial. There is serious concern that he had been subjected to torture and other ill treatment.
Human rights groups say almost 500 other protesters have been killed in clashes with authorities. The countrywide demonstrations began in September after the death of Masa Amini in custody, arrested for wearing her hijab improperly.
Even in the close officials to the government, they admitted that the
I mean, like, honestly, who gives a shit about that, right? Like, if people want to wear a hijab, I say let them wear the hijab. If they don't want to wear the hijab, I say they don't have to wear the hijab. Doesn't matter. Just let them fucking do what they want. It's not the end of the fucking world, right?
government is in a very dire situation. It's just quite desperate, and they are trying whatever they can to just intimidate people, and it's not working as of yet.
Canada added 22 more Iranians to a sanctions list last week. The EU followed on Monday.
We are targeting those responsible for this continued repression against protesters.
As other protesters face execution, human rights advocates say the international community should go further to target the assets of Supreme Leader Ali Khamenei, as well as those of Iran's Revolutionary Guard Corps. A Canadian court has ruled it to be a terrorist entity, but the Trudeau government has yet to fully classify it as such. Redmond Shannon, Global News, London.
I mean, like, this is not surprising in the slightest.
Very troubling and clearly designed to send a chilling effect to the rest of the protesters. We will follow up with the authorities as well about this. And I can only, as I mentioned during my statement, call on the authorities to immediately institute a moratorium on death penalty, to release the ones who were arrested in connection with the protests, and to work towards the abolition of the death penalty. I mean, the report that was issued on the 31st of August is a very important one. It has highlighted very serious human rights concerns. And my focus is on following up on the recommendations that are contained in the report. And for me, it is also very key, and you know that of course we will, and I will personally continue engaging with the authorities. And I believe in, I'm very determined to do so, in Afghanistan, where the continued systematic exclusion of women and girls from virtually all aspects of life is unparalleled in this world. It deprives the country as a whole of the benefit of the significant contributions that women and girls make.
I mean, it's just disgusting, right? Like, uh, that this shit is happening. Like, it's not surprising, but it's still incredibly fucking disgusting.
Unprecedented move, the Iranian regime has been ousted from the United Nations top women's rights body. The U.S. administration spent weeks asking other member states to remove the Islamist regime in Tehran because of its policies contrary to the rights of women and girls. Canada supported the resolution along with 28 other countries.
We're watching what we have been watching for the last 3 months, and we're seriously being told, well, I'm sorry, we can't do this because it's not appropriate. Well, in Canada's view, what's not appropriate is killing people for their political opinions. It's picking up children and torturing them in prison. It's forcing women to dress in a way that they do not want to dress. And that is incompatible with a commission that calls itself the Commission on the Status of Women.
So how significant is this move, particularly as the Islamic Republic continues to crack down on anti-regime protests in that country? Damon Golries is a political analyst on Iran and a lecturer at the Hague University. Mr. Golries, I'd like to start with the news that the regime was ousted from the UN body. How would you characterize this? Is this a meaningful move, or is this purely symbolic?
I'm happy I'm with you, David. Thank you for inviting me. I think it's an important message. I think it's a message. It's a technical move, though, especially on the battle of narratives, which is quite important nowadays.
I honestly think that it's mostly just symbolic. I don't think that this will actually, like, change anything, right?
Let me recall the excellent piece that I read on your website about what Western media got wrong last week. So it's an important message. It's a tactical message, but it's not very substantial strategically. It doesn't alternate regimes' calculations to continue the murder and the killing, and it doesn't really change things on the ground. What really changes an approach in which human rights concerns are included in the strategic interests during the negotiations that the West is so willing to do on nuclear issue, on the support of the Islamic regime to Putin's war. If you put human rights and the real substantial matters of the people of Iran on the table, then calculation will change, and we will see change of behavior of the Ayatollahs.
Right, putting the interests of the people there, and there was some language to that effect. The resolution, of course, was led by the U.S. ambassador to the United Nations, and what she said on Twitter was that Iranian women and activists called on us to do this, and today we got it done. What's your reaction to that statement?
I don't think making such claims by U.S. ambassador is very chic, I would say. I don't think that's a very chic thing to do. What Iranian women and children really want to see is not only a support, verbal support, or a cosmetic support, but also strategical support, as I said. And what it really means is that the concerns of human rights, how the Iranian regime, is trying to suppress the people and their messages, get some kind of interest during these strategical dialogue and negotiations. don't you forget that last Monday, the European Council, which is the highest entity of European Union, came up with this conclusion on after years conclusion on Iran, and it still believes in revival of the JCPOA, which is the nuclear deal. Still believes after 2 years that that's the best way forward. That doesn't really give the.
I mean, who knows where Iran would be currently if the U.S. didn't enact a coup to remove the democratically elected official in 1979. What was his? Check. See. That I'm thinking of. It's a 1950 that I'm thinking about. Yeah, was like who knows where Iran would have been if the 1953 coup d'etat didn't happen, if the democratically elected prime minister Mohammed Mashoggi wasn't overthrown. It, I mean, it still could have ended up like this, but or like how things or how Iran is right now, but we won't know. So
The right signal to
he was
Tehran, to
a
the Ayatollah,
the guy was a
that the
socialist,
West
by the
is
way.
putting pressure from human rights rather to strategic concerns that they have.
So, what sort of a message do you think that sends? Because you do have the regime in this situation where it may want to negotiate over the nuclear deal, but also wanting to repress these protests, right? So, what kind of a message do you think Europe is sending to the regime with this move?
I mean, this is an important one because it supports the people. The people, they think they have some kind of support in their back in the struggle, especially after the recent executions. I think by the regime, which is, I wouldn't call it execution, is state murder. And what would really change if the European Union follows the line of Canada, not only by putting some members of the IRGC, the Revolutionary Guard Force, on the terror list, but the whole entity, which is a state in Iran, on the terror list and designated as a terrorist organization. By doing that, many of their people living in Europe, in Canada, will have a big problem, and that will change their calculations, I think.
All of this is happening as the regime is intensifying its crackdown. We've seen the executions, which you've called state murder. We've seen hundreds of people killed just in the
I
crackdown.
mean, it is though.
Executions after sham trials. How do you interpret this violence in terms of what may happen next as the regime tries to stifle this dissent?
So, as you said, this is a state murder. This is not only execution because, execute someone in only 30 days after they're captured. It's almost impossible to have even a fair trial even with the standards of the Islamic Republic. So let's talk about what's going on. Closed societies, especially totalitarian states, regimes, in these cases, Islamic regimes, survive and rule by the virtue of two important elements. First of all, they divide people by gender, man, woman. Think about the scarf and how important such a scarf is as a matter of repression, but also to divide the society, the half of the society as men and the other half as women.
Where have I heard that before? I'm not talking about just I'm not referring to just the divide of man and woman. Where have I heard this before? It sounds fairly similar to something that goes on here. I wonder.
But also religion, Shia, Sunni, Christian, Jews, and geography, center and periphery. And by doing that, by doing this division, atomizing the society will bring a clashing between the entities. By bringing a clash and also use the second element, injecting fear and terror, they always try to rule. What's happening in Iran right now, after more than 3 months, is that even after the public execution, there was this beautiful video I saw that a very young girl was walking on the middle of the street of Mashhad, where the young guy was, the young detainee was hanged a few hours ago, and walking there without fear, fearless, and try to give this message that she is not afraid of the regime. And we saw also the demonstrations unfolding in Tehran and in other cities. So the first element of terror and fear is not working. The second is that Iranians have never been so united. So atomization strategy of the regime is not working very well. Iranians are quite united, from the Kurds to Arabs, Baluchis in Tehran, men, women, Shia, Sunni. So it's not working for the regime. Regime has a tough time, and these tough times is going to continue because Iranian people, they know that if they stop, they will see, as what they saw in 2019, probably the shutdown of the internet and a mass murder.
So on that point, and just before we
And like, that's one thing that sucks with fucking Elon fucking over Twitter, is that if Twitter shuts down next year, a lot of, like, Twitter is a huge part in breaking news, right? And not having some way of like being able to do so and show off like the brutality that goes on within these regimes is just crazy to me.
We say goodbye, we are seeing there are going to be more nationwide strikes in the coming days, right? Shopkeepers, businesses, truckers refusing to work. I mean, it seems like they will not relent because of fear of what might happen, as you just outlined. Do you think they can accomplish what they want here and get change at the top in Iran?
Yes, yes. If you look at my country, the Netherlands, the last time the coalition needed time to form a government took them like a year, 300 days. Belgium, it was more than 400 days. And we are in 3 months in Iran. And it's not a democratic Western state, it's a totalitarian Islamic state. It needs time. It needs the movement and the revolution needs time to breathe and to find the right time. And it's cold now.
The funny thing is that if this is a more or if a more progressive or a more progressive of like movement and country happens out of this, it will probably be a repeat of 1953, right? Like, there's no shot that it's not.
Is winter. So I think in the coming months and weeks, Iranian will see the opportunity to come on the streets, but also to strike and to find more open societies like Canada, like Netherlands, like Europe, like United States, to have their support. And maybe the leaders of these countries change their approach, not only looking at the strategic concerns, but also on human rights, values and human rights as part of the negotiations with the Ayatollahs.
David Golries, it was nice to meet you. Thank you so much for your time.
Thank you, David.
Okay. Dubai United Arab Emirates, a hardline newspaper close to Iran's ruling clerics, on Wednesday suggested authorities closing the. Is this what I think? Yes. Close the stats of Hamas, a crucial waterway of global energy supplies, in response to alleged foreign support for the nationwide protest gripping the country. The suggestion came from the editor-in-chief of the hardline Kayhan newspaper, who is appointed by Supreme Leader bro, I'm so fucking bad at names. Ayatollah Ali Khamenei, in an editorial that could be seen as a tribal balloon. Closing the Strait of Hormuz, to Western countries, oil tankers, and commercial vessels is Iran's legal right. Hussein Sharmaridi wrote, we can even seize a part of their commercial cargo as compensation for the financial damage they have done to our country. It is not the first time that Samar Termini has proposed closing the strait, though, which around 1/3 of oil trade by sea passes. The narrow gateway at the mouth of the Persian Gulf has seen several tense encounters over the years. Any attempt to close it would risk a major confrontation with the United States. Which has pledged to ensure the free flow of commerce and could roil international oil markets. I mean, yeah, like America would not be too impressed by that, because businesses would be hurt. But like, honestly, who gives a shit? You guys literally found a way for nuclear fusion. The protests erupted in September following the death of 22-year-old Masha Amini, who had been been detained by Iran's morality police for allegedly violating strict dress codes for women. The demonstrations rapidly spread across the country and marked one of the biggest changes to Iran's theocracy since the 1979 revolution that brought it to power. Iran has blamed the protests and attacks on security forces and foreign countries without proving evidence. The protesters deny any foreign agenda to say they are fed up after decades of social and political repression by leaders they view as corrupt and out of touch. I mean, yeah, I don't blame the protesters for feeling that way. They are 100% justified for feeling that way, and the acts that the Iranian regime has been taking has been absolutely fucking disgusting. Security forces have cracked down on the demonstrations, with rights groups accusing them of firing live ammunition, birdshot, and tear gas at protesters, as well as beating and arresting them. At least 494 protesters have been killed since September, and more than 18,000 people have been arrested, according to human rights activists in Iran. A group that has been closely monitoring the unrest says at least 62 security forces have been killed. Iranian authorities have given a far higher death toll for security personnel, blaming attacks on unnamed separatists and militiants. I mean, that's not surprising that they would do that, to be perfectly honest. Iran has executed 2 people convicted of violent crimes linked to the protests. One of them was publicly hanged and from a crane earlier this week in a warning to others. The Supreme Court on Wednesday halted the execution of a third individual, Mahan Sadarit, according to Mizan, the official news agency of the judiciary. Earlier this month, Sidarat's family had told the reformist newspaper Sharig that his death sentence had been confirmed. He was accused of wounding someone with a knife, acting against national security, setting a motorbike on fire, and destroying a mobile phone. His family said he denied the charges. I mean, that's one thing with like fucking right-wing governments. They will literally blame anyone for like any particular reason, right? It's not surprising that they would accuse him of this shit. Because, like, we saw time and time again with, like, fucking right-wing movements and right-wing governments that, you know, it's a bunch of fucking people who are, like, trying to better a society that are, like, going around fucking murdering people, which just isn't the case. Like the other 2, he was convicted of muharbre, a Fashi word meaning waging war against God, which carries the death penalty. He was tried in Revolutionary Court, which typically holds closed door trials, and has come under heavy international criticism, like as it rightfully should be. Like, that's just fucking ridiculous, man. All right. Yeah, it's completely fucking disgusting that this shit has been going on. All right. So, let's talk about the AI generated art and essays. So, for those who don't know, the AI generated art and essays have been making their way, or I've seen the AI generated art on places like Twitter and TikTok and everything. And the essays, I've been hearing that they are allegedly going to ruin education as we know it, which I don't necessarily agree with. So yeah, let's just hop into it.
Something happened this week. Suddenly people started sharing portraits using apps such as Lensa, turning themselves into paintings and warriors. As a dedicated cultural observer, I couldn't resist.
Painterly Eli, that seemed to be the group favorite.
But what's feeding all these different interpretations?
It's a system that's trained on a collection of images. So in the case of Stable Diffusion, it uses billions of images. And the way that it works is these images are fed into what's called a machine learning model. And the machine learning model basically looks for patterns. Robotic reporter.
Ask for robot reporter, and you get this. Wanted female? There you go. While it may seem like a groundbreaking development, there are also ethical concerns surrounding the use of AI
Definitely.
in the art world.
Basically, you would draw every scene frame by frame.
Just ask this storyboard artist.
I'm fairly concerned as some of my friends have messaged me and some of their contracts have been canceled midway through.
That's what happened to Daniel Harris.
Already this year, personally, I've lost about almost $3,000 worth of freelance work. They just flat out told me, hey, we can just get this AI to do it. It's not as good, but it's way cheaper.
This has
commission work too. That's another thing.
Some ringing the alarm bell saying their art is being stolen. So did they give permission? Well, it's complicated.
Some of them are publicly available. Some of them are licensed out by the model developer. But there's no real guarantee of that across all those billions of images, right?
In Europe, you can apply to remove your images, but not all artists are worried. Animator Winston Hacking is known for his collage style. After using the DALL-E 2 program for these, he quickly came to see AI as a time-saving tool.
It definitely speeds up that process, so you aren't spending a lot of time that you're not getting paid for, doing that pre-visualization work and pitching on something.
But as the technology races ahead, the law lags behind.
We're now starting to see these cases emerge where there's these very real legal and moral consequences out in society, and it's starting to reveal kind of the cracks in AI policy and the slowness in AI policy and AI law.
Meanwhile, the consequences of AI go far beyond art. Remember my line about the ethical concerns of AI? Well, I didn't write it. The ChatGPT bot did. It's right about there.
And this is what we're going to be talking about. This is what we're going to be talking about when we talk about the essays. Is this chatbot here?
Another sign of the brave new world that's already here. Eli Glasner, CBC.
Okay, so I have friends that do illustrations, like, and I'm talking about like this is primarily their job, right? They or like their only source of income, right? So I have friends that do either illustrations or animations or whatever, right? And I have spoken to some of them about this, and they say that I tend to get one of two responses. Either this is going to drastically help reduce time down for their work, and that means that they can take on more freelance work or more commissions or whatever. Or it could be incredibly fucking dangerous because their the stuff that like their work could be put into this algorithm and completely like have people stop commissioning them or like supporting them on Patreon or something, right? Like I'm very like I honestly don't really give a shit too much about IP, but I know some individuals do care about their IP and stuff, and like I support like some of my friends on stuff like say Patreon, for example, and they if they decide that, you know, hey, I don't want you sharing my work and everything, you know, they're very forward about that, right? And like usually uh, they'll have rules for it as well. Like if you're going to be sharing their artwork and or stuff, uh, you know, just be like at the very least, like, hey, just make sure you credit me when you share it and stuff like that. For to me, this seems like a lot of the of what was popping off with the AI generated music. It's very similar to that, right? It I ultimately think that it will I think it could be more beneficial than not. Um or it could just be like a gigantic flop, like with some of the AI generated music, like that one fucking AI bot that was going around rapping and people got mad at because it was like saying stuff that's like a big no-no. um like there definitely is a concern with how the algorithm is being run right now, considering that it pulls from a fuck ton of resources and essentially copies like pixels, like or like the brush strokes and everything via like pixels and stuff, which I think is not cool at all. Um, I want to, like, I am going to ask, like, if I can get a hold of her. Like I know that she said this month was going to be incredibly busy for her, but I'm gonna talk to one of my acquaintances or friends or whatever. Not too exactly sure on on that stance, like where we are currently. I talk to her more than my IRL friends, but I digress. I'm going, like, I want to get her opinion on the AI generated art and everything, and like what her views are, because it it takes her, I believe it was like 2 weeks to finish like one of her animations, and she does two per month. So I'm going to see, or I'm like, when I talk to her next time, I'm going to bring it up and be like, hey, what do you think of this? Do you think this could be like a net positive or a net negative, neutral? Think this will that this could help you out at all, or but I'm not really too sure. I'm not really into, or I don't really do this kind, or I don't really do like animations or illustrations or even music really, so I don't really have 2 cents. Like I said, it from those that I have talked to, it's one of the two. It's either it's going to be another tool that they are able to use, or it could or they're not really too happy about it, because uh, I believe some of them have discussed that or if I remember correctly, I think some of them had said that some of their art was posted into the algorithm. Um, but yeah, like I I know artists are not too happy about it. Some animators aren't. I yeah. I'm just more or less curious to see what my one animator friend has to say about it, but she's been way too busy for that. So so yeah, could probably provide an update on that next time we chat and everything. It definitely, like I know companies will like this because they're able to cash in on it, but that's nothing new. Like, they did the exact same shit with music. I imagine they're going to be doing so with illustrations and animations as well, which I it, when that happens, it's going to hurt a lot of the content creators more than the companies, because it will drive away commissions, it will drive away patrons, it will drive away a lot of other supporters. Like me personally, I'm still going to support those, or my friends that do, but it's definitely it definitely could have ramifications for sure. So the Independent did a piece on it, but so I guess we'll move on to the essay that the Atlantic had posted. So the chatbot that has been popping off, like there's a better chatbot already that's already out, that's not for public use. But I've seen a lot of teachers talk about and like college professors talk about the chatbot on talk about it, but like honestly they think that this is a really useful tool, and they also think that we need to completely rethink how we do education, right? Or how like they grade stuff. Because like I think they said it would be like at least, or it would be like a C plus at most or something like that if people were to use this, because it doesn't really give like the AI doesn't really give like any nuance. Suppose you're a professor of etiology and you assign an essay on learning styles. A student hands in an essay with the following opening paragraph. The construct of learning styles is problematic because it fails to account for the processes through which learning styles are shaped. Some students might develop a particular learning style because they have a particular have had particular experiences. Others might develop a particular learning style by trying to accommodate to a learning environment that was not well suited to their learning needs. Ultimately, we need to understand the interactions among learning styles and environmental and personal factors, and how these shape how we learn and what kinds of learning we experience. Pass or fail, A minus or B plus, and how would you grade change if you knew a human student hadn't written it at all? Because Mike Sharples, a professor in UK, used GPT-3, a large language model of OpenAI that automatically generates text from a prompt to write it. The whole essay, which Sharples considered graduate level, is available, complete with references here. I'm not going to click on that. Personally, I lean towards a B+. A passage reads like filler, but so do most student essays. like I think if anything, this this tool is more of a it shows more of how uh our like how shitty our education system is, and like we need to completely rethink how we do education, because I believe places like, say, Denmark or Sweden aren't really too concerned about this because of the way that they do schooling. Other Western nations, not so much. They are terrified of this because if you can get a B plus by just entering in prompts, is terrifying for them. Sharple's intent was to urge educators to rethink teaching and assignment in light of the technology, which he said could become a gift for students, for student cheats, or a powerful teaching asset, or a tool for creativity. Essay generation is neither theoretically nor futuristic at this point. In May, a student in New Zealand confessed to using AI to write their papers, justifying it is a tool like Grammarly or Spellcheck. I have the knowledge, I have the lived experience, I'm a good student, I go to all the tutorials and I go to all the lectures and I read everything we have to read. But I kind of feel, but I kind of felt like I was being penalized because I didn't write equivalently, and I didn't feel like it was right. They told a student paper in Christchurch. They didn't feel like they were cheating because the student guidelines at their university state only that you're not allowed to get somebody else to do your work for you. GPT-3 isn't somebody else, it's a program. The funny thing about this, though, is that I honestly think, like, personally, I honestly think that this is good. It will help point students in the right direction, as well as it has other applications as well. You can tell this program to say, hey, write me a program for this, like for computer science, right? And then I will, type it out, and then you can test it and everything, and completely change some aspects of it. Like, I think more than anything, this is just a skeleton, or it's more of a skeleton framework. It's the same thing with like the AI generated art for me personally. I believe that it also is like it could lead to like it, more like of more like of tool, right? The world of generative AI is progressing furiously. Last week, OpenAI released an advanced chatbot named ChatGPT that has spawned a new wave of marvel and hand wriggling pulsed an upgrade to GPT-3 that allows for complex rhyming poetry. Google previewed new applications last month that will allow people to describe concepts in text and see them rendered as images. And their creative AI firm, Jasper, received a $1.5 billion valuation in October. It still takes a little initiative for a kid to find a text generator, but not for long. an essay in particular, the undergraduate essay has been the center of humanistic phraseology for generations. It is the way we teach children how to research, think, and write. The entire tradition is about to be disrupted from the ground up. Kevin Bryan, an associate professor at the University of Toronto, tweeted in astonishment about OpenAI's new chatbot last week. You can no longer give take-home essays / homework, even to specific questions that involve combining knowledge across dimensions or domains. The OpenAI chat is frankly better than the average MBA at this point. It is frankly amazing. Neither the engineers building the linguistics tech nor the educators who will encounter the resulting language are prepared for the fallout. Like I said, I've seen teachers that are completely on board with this and think that it is going to greatly help with students' understanding of the material that's given to them. Because essentially, it's more or less just like a what's it called? It's just more or less like a skeleton work or outline, because it lacks a bunch of nuances. A chasm has existed between humanists and technologists for a long time. In the 1950s, C.P. Snow gave his famous lecture, later the essay, The Two Cultures, describing the humanistic and scientific communities as tribes losing contact with each other. Literary intellectuals at one pole, at the other scientists, Snow wrote. Between the two, a gulf of mutual incomprehension sometimes, particularly among the young, hostility and dislike, but most of all lacking of understanding. They have a curious, distorted image of each other. Snow's argument was a plea for a kind of intellectual cosmopolitism. Literary people were missing the essential insights of the law of thermodynamics, and scientific people were ignoring the glories of Shakespeare and Dickens. Again, I think that this will be more of a benefit than it will be a harm. It just means that we have to completely rethink how we do education and build it from the ground up. Like, I've been saying for a while that our education system is awful, and this open chat box is just validation of that. Because if it punches a hole through like the establishment, it's going to be seen as bad, despite the fact that, you know, establishment isn't necessarily always good. The rupture that Snow identified has only deepened. In the modern tech world, the value of a humanistic education shows up in evidence of its absence. Sam Bankman-Fried, the disgraced founder of crypto exchange FTX, who recently lost his $16 billion fortune in a few days, is a famously proud illiterate. Yeah, that's very true, and it was really funny when he fucking Sam Bankman fraud fucking lost all that money. It was really funny. I would never read a book, he once told an interviewer. I don't want to say no book is ever worth reading, but I actually do believe something pretty close to that. Elon Musk and Twitter are another excellent case in point. It's painful and extraordinary to watch the ham-fisted way a brilliant engineering mind like Musk deals with even relatively simple literary concepts such as parody and satire. I mean, no, this is completely a lie. Elon is not fucking brilliant. He's not an engineer. He's a fucking moron who just got lucky and had disposable capital. Like everyone with like half a brain cell recognizes that Elon's a fucking moron. Because like he can't even understand like parody and satire. Like if anything, he's a fucking robot. But it's really funny watching him fucking go under and watching Tesla tank because he made a poor decision in Twitter and kept making fucking poor decisions on and on and on. He obviously has never thought about them before. He probably doesn't imagine there was much to think about. I mean, to be honest, I don't think there's much going on in Elon's head to begin with, so there's that. An extraordinary ignorance of questions of society and history displayed by the men and women reshaping society and history has been the defining feature of social media of the social media era. Apparently, Mark Zuckerberg has read a great deal about Caesar Augustus, but I wish he'd read about the regulation of the print press of the 17th century Europe. It might have spared America the annihilation of social trust. I mean, to be perfectly honest, I think Zuckerberg is a fucking moron too. Like, the smart billionaires don't get involved with like literally fucking anything. Like they don't even come out of like fucking hiding. They just stay hidden. Like, those are the smart fucking billionaires. And I think calling people like Elon Musk or Mark Zuckerberg or fucking what the fuck is the one that conservatives cry about so much? I don't remember. But I think clumping like actual smart people in with those clowns is a disgrace. Like, they're not fucking smart at all. You can have money and still be a moron. Like, Sam Bankman fraud, Elon Musk, and Mark Zuckerberg have proved that very well. Because Bankman fraud lost literally all of his fucking money. Elon Musk is like running all of his fucking companies into the ground. And Mark Zuckerberg has been taking really stupid risks with the fucking metaverse that literally no one wants to fucking use. These failures don't derive from mean-spirited or even greed. Yeah, they do. They 100% do. But from a willful obliviousness. No, it 100% comes from fucking greed. The engineers do not recognize the humanistic questions, like, say, what? Hermeneutic, or the historical contingency of freedom of speech, or the genealogy of morality, or real questions with real consequences. Everybody's entitled to their opinion about politics and culture. It's true, but an opinion is different from a grounded understanding. That I actually do agree with. Like, you're entitled to your own fucking opinions, but, you know, not, and ideas, but, like, not every opinion and idea is created equal. Like, there are going to be ones that are just complete and utter dog shit. Like, look at literally every single fucking fascist. Like, they are so dumb. The most direct path to a catastrophe is to treat complex problems as if they're obvious to everyone. You can lose billions of dollars pretty quickly that way. I mean, yeah, we're seeing that with fucking Elon Musk. And it's really funny. As the technologists have ignored humanistic questions to their peril, the humanists have created the technological revolutions of the past 50 years by committing soft suicide. As of 2017, the number of English majors had nearly halved since the 1990s. History enrollment have declined by 45% since 2007 alone. Needless to say, humanist understanding of the technology is partial at best. The state of digital humanitarians is always several categories of oblivious or obsolescence behind, which is inevitable. Nobody expects them to teach via Instagram stories. But more crucially, the humanities of the fundamentally charged or fundamentally changed their approach in decades, despite technology altering the entire world around them. They are still exploring meta narratives like the 1979 exercise of self-defeat. So yeah, like, honestly, I don't really see a problem with this. I think that this is going to be an incredibly useful tool, or I think both of these things are going to be an incredibly useful tool. I do think that they're, like, with current things with the capitalist system will ultimately be the downfall of this and hurt more people, or will hurt people, but we'll have to wait and see. I still have yet to talk to some artists and animators to see what they think about it. But yeah. Okay, so we got a new Channel 5 that I want to watch. It came out today, and it looks like it's going to be awesome.
He would not do well today in this culture. He was just the opposite of everything they're trying to woke us up today. If Ernest Hemingway were here today, I'm sure he would be totally canceled. No doubt about it.
What?
Cancel culture is people that don't want you to do what you want to do. They want you to do what they want you to do.
Is he talking about cancel culture? Cancel culture isn't a real thing. I honestly do, like, cancel culture is not a thing. It doesn't exist, because if you look at people like Hassan, for example, who are, like, canceled all the goddamn time, it doesn't affect them at all. Like, it's not a real thing. Anyone who thinks that it is completely full of themselves.
That's what they're doing.
The ocean is the same as it has always been.
before man set about in boats.
There are 3 sports: boxing, bullfighting, and racing. The rest are just games.
What?
To go out like a man is to set yourself on fire in the bathroom of your favorite bar. Ernest Hemingway, tell me about him.
Well, he was a man's man, an alcoholic, a womanizer, a philanderer, someone who wrote with very few adjectives, traveled the world, wrote from everything from the green hills of Africa
To the Garden of Eden, to the Old Man in the Sea.
You know, Hemingway was a larger-than-life figure who caroused and drank through the saloons of America to the salons of Paris, hung out with very artistic lesbians, and looked at F. Scott Fitzgerald's penis at one point.
What?
closely.
So should we go to the Ernest Hemingway look-alike competition?
Let's do this!
This is going to be interesting.
All right, here we are. We're in Key West, Florida. Behind us is Sloppy Joe's Bar. That's where the Ernest Hemingway look-alike competition takes place. It's called Hemingway Days. What do they call the Hemingway impersonators?
Papas.
We haven't actually seen any papas quite yet.
It's hard to tell because a lot of people here kind of look old, they're kind of fat, and they have beards.
Some of them have red berets. You think that guy's a papa? Can we zoom in on that guy right there? Nick, sir, are you a papa?
Yes, I am.
What does it mean to be a papa?
You got to look like this. What do you think? This actually is a lot of charity that goes from this.
You gotta look like a 9,000-year-old man.
A lot of kids get scholarships, nursing scholarships, college. Helps this community here. He's a veteran. Look at this.
I mean, that's good.
This. I mean, my God. He's my idol.
Finalist 7 times.
This is my idol.
I'm Ernest Hemingway.
Let's
I'm
go.
Gonna be that guy tonight. I mean, I've been to his house in Cuba. You know, not many people can say that.
What makes you more Ernest Hemingway than the other guys?
Making love every day.
Every day?
That's what Papa Hemingway would have done. Hey, girl.
My man claps so many fucking cheeks. God damn.
I'd say sex had a lot to do with it.
What's the largest animal you've ever taken down?
Big bull elk.
You strangle it?
No. Shot it with a 30-06. I'm an excellent shot, just like Ernest Hemingway was. Well, Ernest Hemingway wrote about life, the running of the bulls in Spain. He publicized that. He was too young to fight in World War I. He became an ambulance driver. He was close to the war.
He commanded a room when he came in, and I don't really do that. You know?
Well, you commanded the whole room to say that you're the most, I mean, you won a contest in front of hundreds of people.
Yeah, and that's probably the most outgoing I've ever been. My name's Craig Fawcett. I'm Papa 2012. I won in 2012. Got to look like Hemingway.
I would like to go back and do some marlin fishing with him on his boat. You know,
he was like a man's man. He was a sportsman, a fisherman, a hunter, a boxer. The booze, the boats, and the boobs.
Ernest Hemingway, hell of a writer. I think I might have had as many concussions as he did. When I was in school, he was required reading. And I went to high school about a mile from where he was born, although our school wasn't built yet.
I mean, he was like notoriously a piece of shit. I never knew him personally, but if I did, I would probably be like, you're a piece of shit. He like drank a lot, which like same, but like don't like beat your wife.
Guys, we're gonna go get slushies and stop being trolls.
No, he's not a bad guy. No. He loves he loves Spain. He loved everybody in Spain.
We're learning stuff with each generation, all right?
All right.
We've got a whole like thousands of years to learn stuff, and so it would make sense that the people in the 1,000 years, like as we go on,
That's what they're doing. They want to close you out to make you be like them, and the way they want you to act.
Ernest Hemingway made his home here in Key West. You know, he'd hunted a lot of things. Lions, tigers, elephants.
And that booty, apparently. God damn.
Even man on occasion.
You know, there were rumors at his fourth marriage. They were up to some things. If you see the Ken Burns series on Hemingway, maybe he was doing something else on the side.
You think that maybe Hemingway swung both ways?
I would say swing both ways with men, but I think his fourth wife, they had certain things that they did with one another or to one
What?
another.
Oh, like she was pegging him. Do you think you have what it takes to become the next Papa?
Yes, I do. I think I've got the look. I think I've got everything that goes with it. I'm a little more irreverent than maybe some of the others. But yeah, I think I do.
Professionally, I work as a clinical psychologist.
What does Ernest Hemingway mean to you, you know?
I think Ernest Hemingway has a uniquely American message in his work because it's unapologetically optimistic.
As a psychologist, does it trouble you that Ernest Hemingway killed himself because he wasn't a good writer anymore?
That is an outcome that's not uncommon given his time, his place, his life experience. We're having a lot of fun here.
How do you want to go
I mean,
out?
that's just more sad than anything.
Sneaking in a beautiful woman's bedroom and getting shot by her husband.
What?
In my
What? Who wants to go out that way? Bro, what? No. Leave her alone, man.
opinion, the manliest app on the market. In fact, hi guys.
You have to actually have lived these stories. You need to have been shot at. You need to have been bitten. Fort Lauderdale Beach. I leaned on a kid's Camaro. He didn't like that. All I know is I got up off the beach. I was covered in sand, broken cheekbone, which still plagues me to this day.
What's the closest to death you've ever come?
Swimming with sharks, hanging with Jamaicans, hanging out with Colombians. Say no more.
Your name's Dave Hemingway?
I got it. It's because he was around black people. Like, no. That's not a thing.
Hemingway?
Yeah.
You're related to Ernest Hemingway?
Not related, no, not related.
Your last name
the
is?
first Hemingway that ever won the contest. It takes perseverance and somebody who's not overly concerned with winning, because the Hemingway Society is more like a fraternity.
So here we are right now. We're inside
It's like a
Sloppy Joe's.
cult,
It's the
man.
semifinals. All the dudes behind you right here, they're called the Papa Judges. They're all former contestant winners. They're going to judge the whole competition.
Contestant Tim Stockwell.
Thank you, Mark. Mamas and papas, the excitement you bring is outstanding.
Hemingway would say more badass shit than that.
And if you give me the opportunity
True.
and the privilege to be a papa, I will work tirelessly.
None of these guys have like killed a giraffe or anything, and it's like.
Nope.
Everybody here tonight, I'm often called out with, "Hey Hemingway, I love your books."
Been to the bar in Venice, Harry's Bar, been to bars in Paris.
And I want you to know that there are bigger fish than this out there.
Oh my God, look at you. And look at you. And look at all of you.
Just like Papa, I love Sloppy Joe's, and just like Papa, I love my rum.
God damn, that was fun.
Who do we think's gonna win?
My strategy is to be different. My strategy is to stand out. Throw it out there. Don't sit there being mumbler in the microphone, as I call them. But a lot of positive energy, a lot of good vibes, and go out there and just put it out there.
You got it, baby. We're here. I didn't get the message about the damn shirt. Look at that, man. You see that? But you know what? I got something for you right now. A 1 and a 2. And I'm just a wannabe who's wrong as wrong. Well, I'd like to lay naked when I sing this song. We're back in Key West at old Sloppy Joe's. And what goes down from there, nobody knows. Hey, it's a
What?
drink wannabe's drink. Yeah, baby! Who's gonna be Papa 2022?
It is 7:15 p.m. Eastern Standard Time. They just wrapped up the final round of the Hemingway Days competition, so within about 30 minutes, they're going to announce the new Papa. Do you think the new Spider-Man movie's too woke?
I haven't seen it yet, but probably is, yes.
What?
Why you're a man wearing a Spider-Man costume with the Confederate flag who works for InfoWars?
Well, we don't call it the Confederate flag anymore. We call it a rebel flag or a Southern flag.
Oh,
You work for
no.
InfoWars? Freelance. You know.
How's the war going?
Excellent. We're whooping ass. Nobody likes the New World Order anymore.
I'm just surprised because I didn't know that Spider-Man had political.
How big of a loser do you have to be to do that? Like, surely it's got to be. Surely you have to be a very big loser for this, right?
Leanings.
It's not politics anymore, it's war. Politics are over, dude. Politics are when you negotiate. No more negotiations.
What?
We're gonna start war?
No, we're gonna militarize the border and legalize marijuana. That's what we're gonna do.
What?
What do you think Spider-Man or Peter Parker would make?
Like the legalization of pot is pretty dope, not gonna lie, but like literally everything else just kind of sucks, not gonna lie.
Of the World Economic Forum.
Well, he would tell you that there's a reason that it's in the capital city of Ethiopia. Okay, why is the Economic Forum headquarters in the capital city of Ethiopia, folks? Why? Because that's where King Solomon kept the Ark of the Covenant. I mean, that's where the Ark of the Covenant is, but that's where King Solomon's bloodline is when he married the Queen of Sheba. So that's why it's there, yes. That's the only reason it's there. Otherwise, it'd be in Copenhagen or Washington, D.C. or somewhere else. Yeah.
I think it's in Belgium.
No, the World Economic Forum for the UN is headquarters is in Addis Ababa, whatever, Addis Ababa, Ethiopia.
And that's where the Ark of the Covenant is?
Is he trying to say Alibaba? Is that what he's trying to say?
Covenant is in Ethiopia, yes. Yep.
You're the first guy I've ever seen that has something this cool in my life.
Oh, thank you. It's called Made in the Shade.
Do you have an engineering background?
No.
Do you think the devil is real?
Who?
The devil?
Nah, it's bullshit.
True.
Ernest Hemingway?
He was okay. He was kind of a pig. You know, he was married 4 times, divorced 4 times, had 2 wives, had one here and one in Cuba at the same time.
You think it's kind of weird that all these guys are dressed like him?
Everything's weird here, but you know, you just let it be. For
I like this guy.
I had a hooker that was renting from me, and she was saying that she was helping save men from ruining their marriages. I didn't understand that logic. But.
Jeff is my favorite Papa, but I don't think that he looks or acts anything like Ernest Hemingway. In a way, I think that makes him the most Hemingway-like. Yeah. Hemingway being a man's man, radical individual. Jeff is Hemingway, not these other douchebags. I thought that the previous winners of the competition, the Papas, had sort of a smug attitude.
I'm Ernest Hemingway.
I mean, it's a lifetime appointment. The only other people in America who get that are the Supreme Court judges, and they just banned abortion.
True.
We are happy to have you. Man, you are just packed in here tonight. Look at this. Love it. We have some heavy hitters on the schedule tonight. Heavy hitters. Come on, let me hear ya. Your 2022 Papa is
How do you feel, man?
Oh, woe is me. Woe is me. I'm devastated, totally devastated. But you know what? It don't get no better than this.
Is there a part of you that feels like you kind of got robbed?
No, not really. I know everybody on this stage that made it. Hey, it is what it is.
There's something to be said for just like taking everything in stride.
He's handling a lot better than I thought he was going to.
Keeping it pushing.
Sure, you see it. We're having a good time.
Appreciate you, Jeff.
All right.
Thank you, man. How do you feel right now? You just won.
Ecstatic.
Can you describe the feeling of ecstasy?
I wouldn't go quite that far, but as happy as I've been in a long, long time for sure.
Why you?
I've been here a while. This is all about an education fund. It's also about a family and friends. And this is a very, very tight group of brothers.
The more money you raise, the better chance you have.
Really?
Yep.
Interesting. What's the most confusing and mysterious thing that you've ever seen?
Confusing and most Skinwalker Ranch.
What if
No shot, bro. No shot. Does he believe in that stuff? No shot, right?
What is a skinwalker?
A skinwalker is a shapeshifter out in the Utah Basin that the Indians, over the years have said it's in the basin. It's a shifter. It can go from.
I mean, to be fair, like, I think this shit is very interesting. Mostly because, like, It's just, I don't know, it's just intriguing to me. But it's wrapped up in like a lot of fucking conspiracies or conspiracy theories though. But it's very interesting.
A person, it can go to a coyote, it can go to any certain shifts and a shapeshifter, but they have those out there in the Utah Basin where the Skinwalker Ranch is.
What do you think Ernest Hemingway would do if he saw a skinwalker?
I really hope that Andrew goes to the Skinwalker Ranch. I think that would be a very interesting video.
Shoot it. He'd probably try to shoot it.
What's the biggest bird you've ever seen?
I saw condor out at the in the Grand Canyon.
Well, damn. Okay. I guess that's where we'll call it for today then. It covered a lot of stuff and everything. So yeah, I guess tomorrow will be more with we'll do more origami stuff and we'll see how that goes. Yeah. So yeah, we'll see everyone next time. Hopefully I can get some updates on the from some of the animators and artists I know and see what they have to say about the AI generated art, and then I'll provide an update next time. Till then.